I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. First order of business to be approving minutes from June 1st, last Monday.
Tuesday. Last Tuesday.
Tuesday, yeah, last Tuesday. It's normally on Monday, but it's still June 1st. I have that part right.
Don't take much to get in a rut, does it? Also,
Donna's moved,
All second.
Tim seconded, all in favor?
Aye.
Motion passes 5-0. Consent agenda, move to authorize and direct the chairman to sign the Coffee County payroll notice for Lisa Ryan, new hire, subject to regular IPP Sheriff's Office Jailer, classification 25-12, wage $18.98, effective 5/27/21.
I'll move.
Jesse's moved.
I have some questions on this one.
Okay,
They're starting at 1898.
yes. I don't, we can table this and ask Mr. Johnson.
As Lisa mentioned something to Andrew before we started, has Lisa been employed in the sheriff's department or dispatch office for?
She was a previous jailer, and I'm not sure when, but she was a previous jailer. I couldn't get a hold of Tom. I did try to call him.
Couldn't get a hold of him.
If you want to table it and ask a question, that's fine by me.
Yeah, let's go. I think we ought to ask that question. They've got the flexibility to start out 1, 2, or 3, or maybe 4 and 5, but going all the way to 12, we probably need to know why.
That was my concern.
I might be able to get Angie started.
We can table it and move on. And then if he wants to come in later, that's fine. So the next one, upon the request of Coffee County Housing Authority Board, move to authorize and direct the chairman to sign the real estate mortgage release, acknowledging satisfaction in full debt secured by Michael L. Crooks, Ricky L. Crooks, and Carolyn S. Crooks. Common address is 151 Cumberland Street in Burlington, Kansas, with a long legal description that I'm not sure needs read, so. That would be in my
Just ask
district.
that as your district or mine, which don't we?
Yeah.
Also, Mr. Chairman.
And I'll second it. I mean, if the housing authority's approved it, then I'm gonna.
I would question whether that's a mistake on the address, because I don't think there's a 151 Cumberland Street, Burlington, Kansas. That would have to be clear down by the river.
Actually, you're right.
I think it's probably 1551 or 1150.
Cumberland Street.
Probably a typo.
Yeah.
Do you want some more clarification on that? So
Should we not make
Yeah,
sure it's the
Yeah.
correct address before we do approve it?
probably should. Never thought about the 151, good catch, Bob. So there's 2 we're gonna table for,
I can get a hold of them because that
yeah,
was
just,
their wording.
yeah, just get over Rhonda. I'm sure we can get it done before the end of the day. Don't say anything there. Miscellaneous motions upon the recommendation of Sheriff Johnson, who authorized and direct the chairman to sign the revised table of organization for the sheriff's office.
Mr. Chairman, this is a list, as I understand it, a list of what you would call authority in his department.
Yes, sir.
Does he have a regular organizational chart
I believe you presented it to us.
I haven't seen one and if I have, I've probably just forgotten about it. To me, an organizational chart is gonna be where all the departments are broken down, funneled through.
Yes, he presented one.
We've seen one here not too long ago.
Yes,
Okay, all right.
yes, it was.
I think on this, I just got name changes anyway.
Would be my guess, but yes, he did present one. Here was just a couple weeks ago. I'm sorry, it's in my pile here.
It don't take long to get buried for a week.
No, not without my file cabinet.
But he did present one.
Yes, he
Yeah.
did.
He did. Oh,
This just
So this is probably just a name,
solidifies, I mean, the
name up there.
chain of command, so to speak.
I'd go ahead and so move.
Don's moved,
All second.
Tim seconded, all in favor.
Aye.
Aye.
Motion passes 5-0. Next on the list would be move to authorize and direct the chairman to sign the letters to cities regarding second half distribution of 2021 Park and Recreation Infrastructure Grant Funds.
So moved.
Don, Bob moved, second. Jesse seconded.
I think if I remember right, we want to receive 2 of the city's expenditures for 2020. I think sometime it's a cut deal, it's in our budget, well, I fully understand that. I think maybe next meeting, maybe we could have a detail of all 6 cities.
Okay.
I think 2's all we've received so far. Anyway, we got a responsibility to look at them.
We received Lebo and Waverly.
I'm sorry?
Lebo and Waverly's what
We got
received.
Waverly, but Waverly wasn't done correctly, it wasn't done. But you couldn't get a lot of detailed information out of Waverly. I think if I remember right, Lebo's is all right. I don't think we've seen the other 4.
Sorry, I've got where I left off on that.
Still got a vote.
Good. All in favor?
Aye.
Motion passes 5-0. So yeah, I guess we just get hold of each city and see if they can send it. That gets to that.
Hand this one to us if you want.
No, I put yours actually in your book since you weren't here. It's just a correction on the engineer's motion, spelling of the name. Yours is just in the place in the engineer's report where it was since you weren't here. I put yours in the book. It was a correction on a summer help and spelling. So that's what,
It's back here.
that's all that is I just, whoever wasn't here, I replaced the correct page of the book.
Right here. So we'll move to accept and sign the CP for Riley-ish, summer help, subject to regular IPP wage classification. 5A with a wage of $12.73, effective 6/7/21, number of hours worked not to exceed 560.
I'll move it. Summer help, I'll move.
Bob moved,
I'll second.
Don seconded, all in favor.
Aye.
Okay. That'll get us through that, so. Darren?
One
Good morning. Well, after 4 years as the the administrator of the Coffee County Library, I'm resigning effective June 30th. And I'm going to be replaced by Mary Davies, who is currently the branch director at Lebo. And My son and I are gonna be starting a business here in town, small mall computer repair with focus on the, computer repair. But we'll also have some vendors and stuff, and then we'll have a trading card museum in there as well. And we're gonna be over at the newspaper office, what used to be office supplies. I've enjoyed my 4 years here, but it was time for me to try to do something else. But was very fortunate that we were able to go ahead and do an internal candidate. And I'll just go ahead and introduce Mary here. It looks like she knows everybody already, so.
Yeah, I don't believe I know Tom.
Nice to meet you.
Nice to meet you too.
Welcome aboard. I mean, of course, you've been aboard.
I have been aboard. I've worked for the Coffee County Library for 22 years. And so I've been in Lebo that whole time. And so I'm looking forward to the challenge of the whole system. And we're working on getting my replacements and shifting those positions too. So
Awesome. Congratulations.
thanks.
Welcome.
I'll miss going home for
Thank you,
lunch
Darren.
every day. So.
And thank you, Darren, for your time.
Good luck with your adventure.
Feel free to come in.
Will do.
If you like baseball cards, I got them all the way back to 1880, so.
Got it. Awesome.
Thank you.
1880.
Been here a while.
They play baseball.
Well, that'll put us ahead of schedule. Amanda.
How are you guys?
Good morning.
Good morning, Amanda.
I know I have a couple more people coming. I'll introduce them.
Whoever, his short speech got us a little
It's
ahead on the
okay.
schedule.
I'm a good talker. I can fill space.
Thank you.
I do have Sherry Knight with
I'm
me.
not gonna comment.
You're not going to talk to me?
I'm not gonna comment on what you just said.
Oh. She is our CFO. All right. Well, how's everybody? Doing okay? Getting the sunshine.
Yes.
Got through the rain for a little while.
I thought that was kind of unique, is that how is everybody? Everybody okay? I mean, your mental wellness, you're
Now
asking me,
listen.
you're asking me that?
Are you doing okay, Bob?
I'm doing fine.
Better ask his wife.
Right. Or you guys. Well, I appreciate you letting us come in today. I've given you 3 different things. So one is our letter of request. The other is our annual report. And then the card is just Coffee County specific. So the annual report is what we provide to commissioners every year. I know you guys are invited to our Zoom annual meeting. And usually we try to do that in person and kind of go through a presentation and let you know how we're doing. But it was by Zoom. I think you got all these materials earlier as well. But it's good to go through that and kind of see what we've been up to in 2020 to show how we're utilizing the funding that we receive and what's going on. So the first thing I like to point out in the book is the board members, and just really say thanks to them and our appreciation. So Carl's in the room has been a previous board member, is no longer, but Sarah Steiner and Kara Reeves continue to serve on the board, which means we have a vacancy. If anybody knows anybody that would like to be on our Crosswinds board. And then also the staff kind of years of service. It's really cool to look at how many people have been here 5, 10, 15, over 20 years. We do employ about 175 people, so when we start to get those high numbers that have people that stay, is always a really good thing. And then the highlight for you guys would be the budget page. So just really looking at a quick overview of our what we bring in, and then our expenses with the end result of the net amount. And so you'll see with COVID money, we did look like we did pretty well in 2020. I just want to make sure that you know that that's inflated because of COVID money and Spark money that we received. So just don't want that to you guys to think that that's something that's gonna continue to happen. Without any of those, monies received, would be about $700,000 in the hole. A little bit over that.
How much of your total money was PPP money?
How what?
How much of your total money was the PPP?
So we did phase 1 and phase 2. So we were able to get, about $996,000. $966,000 for that first one. And then the second one, we haven't utilized at all because we're not sure what will be asked in return. But we were able to qualify for that being 25% down at least in 1 quarter. So definitely took advantage of anything that we could. And we always want to say thank you. I think last time I was here, thank you for the assistance that we received and working with us to help with those funds. So I think I saw Karen walk by.
Hi.
Karen's a board member as well. So for the appropriations, historically, I'll catch you up and I'll have Sherry kind of talk to you about what we're asking this year. But in 2018, we had our first positive year in, I don't honestly know how long, at least 5 to 7 years. And so we came in and said, we're not gonna ask for anything else because we got to a business plan where we felt that we could cover ourselves and wanted to say thank you for commissions that have supported us and not raise that. And then last year with COVID wasn't the time to increase that either, because money's definitely stretched for everybody. Previously, we had taken an increase of 10% across the board for all 7 counties and then broken that down by how many people are served. And so this year, we still want to maintain a good partnership. We are not where we were prior to COVID, so we know that we need some assistance, but we also know that everybody's asking for assistance, and that's a difficult thing. So I'll let Sherry, just so she can get some microphone time, talk about
It's very important.
what we're asking this year.
So we decided this year to go for a 2% across the board ask to increase for our total county dollars that we receive. In your case, on this blue card, it shows that 10% of the clients that we serve are from Burlington or from Coffee County. So that is the 10% of the 2% is going to you guys. So the total would be 99,000 that we would be asking for. So that would be that increase that we would be asking for you guys.
And last year we were at 90.73, so if you're going to find. So just a slight increase, just hoping to kind of get those numbers back up where we can maintain and make sure that as we're moving forward. What we're definitely finding is we've actually, compared to my colleagues, been very lucky and kept a lot of our clinicians and continue to add. I think we've probably added 7 in the last several months, and so we could still use more. And so we know services are growing. So speaking of that, because my colleagues just joined me behind me, Kayla had been serving as our Coffee County manager for the last couple of years, and we've asked her to step up and be a director at our agency over a year ago now, and so she's been wearing multiple hats, and so we just actually hired Matthew McGee, who's going to step in and serve as Coffee County manager. Previously, Kayla was serving Coffee County in Greenwood, but because of the growth that we're seeing in both counties, we've separated those out, so there'll be a person dedicated to just Coffee County, which is Matthew. So you'll hopefully see him and hear his name around, and he'll be meeting with our community partners, and Kayla will be taking him around and introducing people and getting him connected. So lots of good things happening. That means we also just hired another clinician. So we should let you talk about it. Yep. In Burlington, so that'll put us up to 2.5 individuals that are serving clients on a regular basis compared to 1 in a day. Yeah. Or maybe half a day. So definitely seeing a lot of growth and still we're maintaining all the services in the schools, which leads you to the piece of paper I gave you and all the services that we will provide for the appropriation. So the outpatient therapy, case management, care, peer support, psychosocial groups, all those things will continue to happen. Emergency services, jail services, for those appropriations. Summer's kicking off. You want to talk about your summer group?
Yep, I was just over there this morning dropping off supplies. So they have 12 kids this summer in the program, and 3 part-time staff, and then Allison running it. And they're off and running. They got the kids over there this morning. There's not a food program this year, so We ran supplies for their lunches over there this morning, so.
You should see the van running around again this So, what questions can we answer for you?
Amanda, since the, I guess we'd call it pandemic, I call it catastrophe that's happened this last year, do you anticipate more services being required for that? Have you done any, is there any studies or anything that indicate that you're, or have you seen it?
We're seeing it. I would say if everything happens on the coast sooner with more population. And so definitely mental health services are growing and necessary. The problem with mental health services right now is you can't find enough workers across the nation. And so most of the talk out there is that mental health needs aren't being met, and it's because we can't keep up with it. Here, we're doing pretty good. Like I was saying, we've actually been hiring people, which is not true across the states. For some reason, we're getting more applicants and have interns coming back and wanting to stay with us. And so we hope we can continue that trend, but it's tough to find. And now our struggle with hiring people is actually our case management and care, kind of that bachelor's and lower level staff. It's just really difficult to find part-time staff for summer groups. Just been very difficult to find people. So the need is there. We can show our data would show you that our intakes are up in December, and I think again in April, our intakes were higher than they've been in 5 years. We look at that stuff pretty regularly. The problem with people calling in and getting intakes, you're going to have people to see them. And so I'll tell you, we do have some that we're saying we're going to refer you out. So insurances that require a clinical social worker, which Matthew actually is, so it's going to help us out tremendously. But we just can't. We have 3 on staff, and 2 of them are directors, and now one's a manager, and so they have all these other duties as well. But we do have to refer out at some times as well. But yes, we will see more and more as people kind of get back out there. Going back to school is always a big deal. Now we have summer, so when summer goes back into school, we'll see an increase again. But yeah.
With that, on the child side, student side, because of the way that the governor made us do the schools, did we see an increase in problems with young adults, young people?
I don't know that I would say we saw an increase in the problems we're experiencing, but always when we go back into schools, we see more referrals because they've been on break or they've been at home. And so when that happened and kids were back in school, which you guys were most of the year, right? Always in school? So I don't know that was anything that caused more referrals.
Yeah. We didn't have many non-school days.
Right.
I think an SCC is only 3 or 4 days throughout the whole year, maybe 5.
But what we're seeing is the more we get into schools, is the caseload grows because we are reducing the stigma about mental health. We're normalizing it, and people are recognizing that resource is there. So any school we get into for 1 day a week, turns into 2 days a week at some point. So it just magnified, just mostly because of the presence, I think, in the results that people are seeing and knowing how to get connected.
This year, in meeting with some of the schools, I noticed that a lot of them were reporting issues with kids reporting anxiety, and then some that felt very isolated and having some depression type symptoms from COVID and those who were learning remotely. So that was one thing that I noticed over the past year from just school districts that I've been talking with.
Did having to wear a mask have anything to do with that?
I
Or can you?
don't think necessarily. I think it was more like the remote learning and not being on site with their friends and getting to do some of those things. So that all related with COVID. And so, yeah.
Kind of all just all together.
Just different, it impacted all of us in some way or another. Even walking in today, I'm like, oh, I know I don't have to take a mask because, last I was here, but that's different. And I even put one in my pocket to have in case. So it just is different for everybody and impacts is different. It's just like any other trauma or something that we have to deal with. We all have a little bit different reactions. Other questions, any needs that you guys are hearing about that we need to be paying attention to?
Probably more out there what we're aware of. That's what's scary.
Always.
That's,
And And really, you know, when we think of mental health, we think of what's in the news and what's in the movies and these really big, large events, but what's out there really that's more than we're aware of is all of us.
It's always a concern.
Yeah, all of us can have some sort of sign or symptom, and just making sure that we're watching out for each other and our loved ones and family members, because, you know, whether it's anxiety or depression or just stress, you know, that impacts all of us. And so what we really want to do is figure out how to take care of all of us so that it doesn't get to those big events that we're so used to. Because those are the events that then kind of cause havoc on all of our systems, you know, whether it's law enforcement or ER, those sorts of things. We really want to look at the lower everyday stuff that all of us can experience at any time and make sure that we know where those resources are.
Amanda, did you mention, med clinic services out here now? No, I'll let you share that. So we've been trying for a while, and it finally worked out where we were able to get, med clinic services out in this area, so people don't have to drive to Emporia for that service. So they can come, we've had them in the jails, but now we have them out of our office, for non-inmates. And so they can just come to our office here in Burlington, and they can connect with their medication provider by Zoom. They don't have to drive to Emporia to connect with them by Zoom. So, and there's, not a nurse practitioner, but somebody, I don't know.
She's just one of our workers that we have in the office.
To take vitals and to do weight and height and all that stuff and get them checked in with the doctor, so.
But really trying to drive to that mission, you've heard me say, making sure services are 20 minutes from home. And so it's much easier for our individuals to, you know, that are in Coffee County to come to our Coffee County office and get to Emporia. And in this day and age, our providers are typically doing all televideo, so you actually would drive to Emporia to get on a televideo, which doesn't feel that great. So now you can at least get to your local office and have that same service. Kayla was instrumental getting that going. She's been pushing and pushing. No, yeah. Yep. So that's a great addition for the county. Pretty excited about that.
Wayne, do you have any questions for Crossland?
Was emergency screenings covered? I just walked in, so. The question I had, because I deal with care and treatment cases, is the whatever the company is in contract with, and the timeliness of how quick those interviews are conducted. Sometimes it seems to take an extraordinary amount of time, and when we have someone either in jail, out of jail, whichever one it may be, that involuntary commitment, to have them sit for what seems like an unreasonable amount of time in my mind before they get evaluated. Is there something that can be done about that?
I think that the system is working the best it can. That's a really lame answer, and I apologize. Even before we went to televideo, that was always a complaint of how do we get somebody to that individual? How do we cover multiple people happen at the same time? And then how quickly can we get that screened? Now, sometimes there's other factors that we aren't in control of, so if they have any substance use going on, where, you know, their blood levels have to be at a certain level, if they're medically cleared, some of those things, depending on if they come into the ER or through law enforcement. But ultimately, it can take, I know that they're trying to get within 30 minutes, and I know that doesn't always happen. What I think we're running into a little bit is they're starting to provide these services to more and more community mental health centers across the state, because we can't find the workers to do emergency services the after hours and the weekends. And so if they don't have enough staff, just like why we have to contract with them, then it slows that system down too. Then that second layer is once they're screened and assessed, then that state hospital waiting time can be really difficult as well.
But we just have what appears to be a failure in the system. I'm not directing it at you. It's a mental health failure that there are huge, wide gaps.
Yes.
And at least locally, our law enforcement officers are suffering
Yes.
as a result, where when there's this in-between waiting period, and more so for people who are not in jail, then, you know, you have to hold them in the least restrictive
Right.
alternative, which can be jail, but that's not ideal for someone in crisis. And when that occurs, then we have to have law enforcement well, for lack of a better word, sit on them, which then potentially puts.
The rest of the community at risk.
Right, well, law enforcement, if they only have so many officers on staff, and then they have to respond to an emergency call, does that put the backup officer, who that person would be at risk? We have to fix that issue, and I think, our sheriff's department, law enforcement are good about responding to those needs, but there's gonna have to be a solution at some point.
And you're absolutely right. You're not saying anything that we would not agree with 100%. I can tell you it's a statewide issue, if not a national issue. But it's definitely a topic at law enforcement, state associations, and hospital associations as well. I would say some things that you will see the state pushing out is the 988 phone lines that should come out in a couple of years where people can call for crisis. There is a large grant out for Beacon right now that they're wanting to do mobile crisis. Don't know if that's for some of our rural areas, that's probably televideo mobile crisis, but it's somehow getting people out to individuals directly. What we're trying to do is we have 2 people, one might be starting today, I'm not sure. But we've had an emergency clinician hired for about a month now that's there at least during the day, because before we were using that contract service during the day and we just hired another one. So our daytime, hopefully, response will be much quicker than it's been probably in 3 or 4 years, because we haven't been able to fill those positions.
What can we do? And I know nationally and statewide, it's an issue.
Yeah.
What can we do locally if the county is to partnership in a bigger way with your agency to help meet the needs? Because we're in a unique position in Coffee County where we can, is there additional funding that could be provided by the county to help bridge that gap? To have somebody full-time with your group that could?
I'd like to say yes. I mean, it's gonna come down to, the reason why we can't maintain community mental health center clinicians is gonna be money. They can go work for an insurance company or a private entity and make easily 20 to 30,000 more. There's also a big push at the state for the CCDHCs, which should align us with federally qualified health centers, so we can get some federal funding, which then would allow us to pay people more. But the legislation actually was the first state to pass that this year, and so that should be being pushed out in the next couple of years, which we plan to be right on board with that through the different community mental health centers. I mean, if we could fund a position that would do that, yes. We have to be able to find the person, and that's what it kind of comes down to as well.
So,
But
so what type of salary would you be talking about to be competitive in the market?
I would say that you're talking anywhere between 50 and 60,000 just for the salary, and not with the benefits.
And that would be for someone to be boots on the ground here locally to respond and meet the needs of Coffee County?
I would say we are closer to that than we always have been. So we've got 2 clinicians that'll be here full-time, plus Matthew that'll be here 3 days a week. And so when you have more people, then when someone calls, we're back to kind of where we used to be able to get to the hospital or get down to law enforcement and be more proactive.
This would be for someone daytime, so to have continuing 24 hours.
You probably have to be a little higher than that. Because for someone to work evenings, and of course, you can't have someone do that all the time.
Sure.
So you're talking multi-staffing, but that would that'd be a start.
So when I was in Allen County, Southeast Kansas Mental Health, had that service, and there was somebody who they would rotate and have the on-call phone, and I remember I worked with those individuals on a fairly regular basis, and they covered a lot of territory. I don't want to speak for any of the commissioners, but my belief is this board, knowing what the local issues are willing to be pioneers and do something sort of outside the box to help deal with this issue.
We need to run that system, so it would be familiar. We'd have to find the people that would do it.
Well, and I'm not even talking about that system, something to help fix what we have here. And I know the sheriff isn't here, but he has voiced his support and helping in any way he can to help alleviate these issues. Because let's be honest, the mental health needs in our local community are significant, severe, and we don't need to incarcerate people who don't need to be incarcerated that are suffering from a crisis.
Right.
If we can get them the support and the help they need in an expeditious way, that would be the goal, right?
Yep. I would encourage us to look at the data and see how many times we're having individuals, and if we can even pinpoint that down to time of week or time of day, we could start there, you know, to move forward with something like that. But, because unfortunately, it's like if you had to go to the ER with a broken arm, you want it done right there, and if it doesn't go well, it feels really bad, but you don't break your arm all the time. So I hate to throw a whole bunch of resource, because it doesn't feel like we run into those very often, but they're really important. So it'd probably feel better to really pinpoint when we can be most resourceful with anything that was given and push towards that.
I would just say from my
Do you
personal.
know how many times you've filed involuntary this year?
I'd have to go back and look at it, it just, you know, sometimes it goes in waves, sometimes I
Yeah,
file
that's true.
a case within a case because you know, sometimes they just go to the hospital, they're stabilized, we need to have a better mechanism to track and support these people, especially
Yeah.
on outpatient treatment orders. And I think that needs to be worked on to make sure they're following through with their medication management, which oftentimes is what it is. They get released
Right.
from whatever facility with a 4-day, 6-day, 8-day supply of whatever the medications are, and then once they run out, then we're sort of right back where we started.
Yeah.
And I think we gotta fix that. We gotta do something different because it's not working.
I mean, I was talking to the hospital administrator, and he was saying that this upgrade and remodel of the hospital is gonna include addressing the mental health problems and crisis, and there'll be a room
Putting
that,
a safety room.
safety room. So I think that's a good step too.
And that's a part of that, gosh, I can't think of the name now, but that all the different community members coming together to talk about the mental health needs. It hasn't met in like a year now, but I know Lindsay Payer kind of spearheads it.
Yeah.
The mental health
Important.
commission
Yeah,
committee.
but I think we're planning on meeting here in the near future.
Okay.
I was just talking to Lindsay about that a little bit ago.
So some of the screenings that are after hours that are done remotely, and I've dealt with people who are screening from Milwaukee, Wisconsin, from San Antonio, Texas. I mean, that's just where they are. So then they have to testify by Zoom, which is fine. But some of them are very good, and some of them
Not so good.
I'm not impressed with. And
So we maybe need to be having some ongoing conversation that we can do better with, and be more supportive in the screen that you're part of. Because we can help with that too.
anything we can do to sort of help bridge the gap. So,
Yeah. I agree. It'd be huge.
I kind of agree with what Wade said. I've been here a long time, and I just want to commend your board, your previous board members, and you and your whole staff, because before they made the change, actually, I guess the time you became the director, I've seen a lot of changes and a lot of positive attitudes on Crosswind since then. And I don't really like to say it, but I don't think we were not where we wanted to be before your board decided to make that change. So I commend all of you. I think you've done a fantastic job. Got a lot of ways to go.
Yep.
But Wade, if you'd seen us before, you would say, you'd say doubling what you just said. So
Okay.
thank you guys.
But there is
Karen,
lots.
all you guys.
So we just need to probably pull together and start some conversations on this. Definitely.
Anybody else?
I think it's a necessary thing, you know, for the area these days, is mental health, you know. The unknowns are out there. You just gotta sort them out and find them.
Well, it's a whole body picture, so we've got to find ways to keep ourselves healthy. And that's just gonna be an ongoing continuum, from our brain down to our toes. You know, you guys have a great wellness committee, and this goes right along with it. How we take care of our well-being is important. And it's definitely not going away.
So we need to turn this into a motion.
What's in?
Yeah.
No?
What? No, we'll take a look at them. We don't.
It'll be part of your fund budget
Just-
conversation.
Okay, yeah, that's right, sorry.
Take the information and soak it in our head.
Appreciate it.
Which is probably not gonna be a problem usually, so that's why I said we need to turn it into a motion. So.
I guarantee I'm gonna.
Well, thank you guys. We appreciate it. Appreciate the feedback, questions, and the ongoing support. We value that relationship.
Thanks for what you do.
Thank you.
There's no way to put it, truly, there's no way to put a value on it. In my opinion.
Thanks for coming in.
Thank you. Just let us know if you need anything else.
Thank you. Have a good week.
Derek, how are you, buddy?
Good, how are you?
I guess we're ready. We're on a little ahead of schedule.
Well, I came early.
Thank you, Wade.
What?
How you doing, Darren?
I'm doing okay. Everybody had a good weekend and a good week today.
The mood is declining.
Yeah, I'm working on that. How are you? I didn't send anything down prior because we had a turn of events Thursday evening, I guess, Friday. I prepared 2 budget requests because I did not know how you guys in the past, and I'll get to this in a moment on some of our federal funding, big item projects, I have tried to give you guys 2 or 3 years in advance so you as well could budget for a big project. Thursday evening, I received an email from our engineers and from the FAA. We had planned on in 2023 and 2024 in 2023 to do the engineering portion of some concrete work around our T hangars. The concrete there is doing the same as our runway was, the ASR, and flaking and coming apart. It's not as critical of an area as the runway was, because obviously of speed factors and stuff on landing, but 2023 I had in our 5-year expenditure plan was asking for $30,000 for matching funds for the engineering portion, and then $102,000 in 2024 for the construction portion. And that would have been a 10% match of a $1.2 million project. I guess I skipped over the budget a little bit, but I'm getting there. My email Thursday evening was the FAA has tentatively spoken for some large item projects in 2023 and 2024, and they would like to fast track ours to 2022. I was not expecting. So the first budget request form I have here is asking for public support of $305,000. Last year, we asked for $290,000, and in 2020, well, 21, our public support was $290,000. 2020 was $310,000. As you guys know, I kind of cushioned our budget for a couple years ahead of time because we were closed last year for 5 months for the runway project. So we do have a little bit of a cushion in our account, but I always try and keep it there for unforeseen items. So this year I'm requesting just for general operating for 2022 was $305,000. We showed a $28,887 loss last year. Part of that COVID, part of that 5 months being closed. Our actual gross receipts were $200,000 less than 2019. So just kind of playing the numbers game to try and keep us up there and still get our value for repair work at the airport. The second one I have here shows a public support of $575,000. I didn't know if you would want this on the budget request form or to separate it out. In the past, I had separated it out for special line items or however you guys call it. I included the budget for the repair work that they're wanting to do, that breaks out each item, what local cost is, FAA cost, and total cost. The second one on the project budget shows $270,000 of matching county funds. Like I say, I like to give you guys a couple years to plan on this stuff, but it hit me Thursday, and just try and do whatever we can do to minimize the county's input on maintaining the airport. It was built, it's there. My job is to keep it operating.
If we don't do this next year, how far down the road are they gonna stick it?
It would be after 2024, I know that.
And we've got the new runway, so we kind of need, it'd be nice to have decent aprons and everything, and all that, taxiing lanes and all that in order to utilize it.
The apron rehab portion, I think it was $150,000. I don't know, I got so many numbers this weekend. But I think it was $150,000. That's cleaning out all the cracks, resealing any portions of it, because it's fairly new. We built it about 7-8 years ago with matching federal funds. So, but now we have grass growing up and we spray once a month.
So if this goes to 2025, we can guarantee that 270,000 is not gonna cover our part of it.
No, in fact, the prior numbers for this were a lot less, as far as the $1.2 million. And they inflated it to try and make it, because everything's got high, as you all well know.
Probably about double it if you wait until 2024.
Unfortunately, I'm afraid of that, yes. One other thing I'll throw out here, state grants, they have matching grants for doing construction work and stuff. I haven't applied for one of them in several years because we've been following right along with the federal grants, and they've been working with us and we get along good. I think the applications are due in September, but I wouldn't apply not knowing if I had a blessing from you guys to do this. But I could apply for $165,000, which is the additional funds. Then it would be $105,000 if they approve that. Since we have not gotten a grant from them for several years from the state, I'm pretty confident that, but I cannot promise that it would be favorable to them. The other part of that is because they like to have their press releases that say, in conjunction with Coffee County and the Federal Aviation Administration, we completed a $1.2 million project at Coffee County Airport in 2022. So that would lessen the burden on you guys, and I know I'm throwing it out really quick, but I just received it a couple days ago, so.
On the state funding, any idea of the time frame would be involved in that?
Of being what?
What's the time frame involved in the state funding?
It would be, I would have to have your blessing as far as the $270,000 match. And then applications would go out in September, and I would know within 60 days probably. And then I would just come back to you guys and say, yay or nay, they didn't.
So you should know September, October, where the state funding be.
I should, yes.
Which would be just a plus on top of it.
Yes, it would just be, it would lessen the amount that you guys have to put in there. So it's I was really shocked when I got the email, since we just completed a $4 million project, and that $4 million project cost the county $400,000, but it was either that or no runway. So like I say.
But the actual construction cost came in considerably less than the projection, correct? So we didn't end up spending near as much, our 10%.
Yeah.
Wasn't
As much as we.
near as much as what we expected. it to be.
Anticipated around $500,000, and we got some really good numbers.
Excuse me, could you get us a copy of, our funds, like our funds that we have available?
Yeah.
Please?
So, and on the first budget request showing the $305,000, I did for 2020 and to date as of 2021, pardon me, a copy of our profit and loss year to date, which shows our expenses. I seen something in the notes that you wanted to see our expenses. It's kind of hard to discern what is capital outlay, what's contractual. I've done that, but it gives you an overview of what we spend.
Brandon's back with us now, right?
Yes.
So we're not
Yeah.
saving some expenses there.
Right, during the shutdown for 5 months, we leased an entire hangar over there, which,
Bob, there's roughly 4.4 million in community improvement, and then capital improvements around
What's in this year's capital improvement? That's what I'm,
8
million.
8 million sitting there now.
Okay.
and like I say, it wouldn't be incurred until 2022, but to apply for the state grant to lessen that $270,000 down to maybe 110.
It would be crazy not to do it, so, in my opinion.
It's just me thinking out loud, but and I'm speaking just for me, I'm a big supporter of the airport. I think if we can get the state grant, I think we should go ahead and apply for it, because even if we don't get it, I think we can use actually this year's capital improvement and retain it for the next year's project. But I'd like to get it done because I think we're gonna save enough money that it would make it well worth it.
Yeah, in the long run, it will have a large
And
saving.
actually, as for this year's capital improvement, I don't think we're gonna have any big items that's gonna need the $8 million. I mean, but I personally think you should go ahead and apply for the state fund, because I feel like that one way or another, we need to continue to keep our airport up to the best we can do it.
Right. And it's, applying for these grants, and I explain it, and I told some of you in the past, my dad, at some points on some of these projects, he's a farmer, and he said, that's crazy spending that kind of money. So the federal government puts that money out there, it's there, it's going to go to an airport somewhere, whether it's Coffee County, Kansas, or Chicago, Illinois, or, so crazy not to attempt it.
Right, I agree.
I'll agree. Yeah, so.
If you redo all the concrete around the building, will that shut any part of the airport down?
The T hangar portion will be tough for our people that rent them and keep their airplanes in them. Right now, we've got enough room. We could, with some shuffling in 2022, put 8 or 10 of them in the north hangar.
North hangar?
And we've got some that are, that don't fly much at all. It wouldn't be a huge issue, but we would do our best to accommodate them. With the runway closure, we lost a couple of ag operators. And when I say lost, for the year of 2020, because they found different places to operate out of. One of them was unable to work out of Eureka. They bought $65,000 worth of fuel the year before and bought zero last year. Well, they worked it out so they could work it out of Eureka. They're there now working, and I'm doing my best to get them back up there, but they can still work out of Eureka, which is closer for them because they're out of Toronto. The company is, but I feel like we'll eventually get all of them back. It's just they got comfortable at another spot, and which I assume would happen. So,
Our expenditures, capital improvement expenditures for 2021 are $241,000. Can we earmark money from this year's capital improvement for a project for next year? That's legal.
Yeah.
Okay. And then next year, our capital improvement so far is only gonna be $161,000. and we're looking at 8 million. So, I mean, we'll need to discuss it, but that's kind of what I'm thinking is that it's probably a no, in my opinion, it's a no-brainer. Especially if you can get another 160,000 from another grant
To cover that gap a
to
little.
cover the gap.
Yeah. And I hate you coming in with this sort of notice and sounding like a greedy child, but it's thrown in my lap and I want to do the best I can.
You're taking the action that you're
Yeah.
required to do.
Right.
There.
Yeah, so it's,
I don't have any problem supporting it at all,
Okay.
even if it stayed at 270, for what that airport means for the county.
Right.
It'd just be a huge plus to give another grant for 160.
Oh, you absolutely.
160 is what the grant would be,
165.
165.
Yeah, please, $100,000.
$105,000. And like I say, no guarantees, but I would definitely be applying for it tonight. I'm pretty confident because I have a good working relationship with the FAA and the state. I'm pretty confident of their support, so. But again, I cannot guarantee, but pretty confident in it.
Worth a try.
Okay.
Awesome.
And like I say, back to the budget, I increased our public support 15,000 for this year to, and as I said, I increased a couple years prior to 2020 a little bit to give us a cushion. So there is some room to work there, but I just want to keep the cushion at the airport. So if something does come apart, so.
Are you guys, are you still in the process of searching for a low wing?
We've got low wing, you mean
I mean, high wing, sorry.
Not at the moment, no.
Okay. Yeah. But
Danny's going on
Danny, yeah, Danny's gonna be gone.
it, yeah, 9 months or so, so.
And you are aware that we had a motion to, next year could be 6?
Yes. We, 2 of the 3 Flight Scholarship students, Atlee Pankowski, he's really close. And one of the young ladies is, well, Russell Suzy's daughter. She's kind of a natural in an airplane. And he's hoping to get her finished before he leaves mid-July, but we'll see. If not, we are going to get her finished. And the other one's working hard at it, but we're getting there. So COVID shut them down. They couldn't fly.
Do we have someone else to bring in? I mean, a 3 years ago, we had, when Danny was gone, we brought,
When that gentleman, is no longer available, and, you know, we're in Burlington, Kansas, it's hard to call somebody. I have a guy out of Ottawa that has offered to help us out, so I'll do my best, at least for this year, to get them finished up. And Danny has talked to him, but Danny's pushing really hard right now to get them finished up before he leaves. So.
good.
What's that cost for pilot's license for the school there? Well, I mean, to get a pilot's license, I guess I should say.
I'm gonna estimate just general public coming in off of the street, there's a minimum of 40 hours, and you're looking at 140, 150 hours. Pardon me. Minimum of 40 hours, it's $140 to $150 an hour, depending on which airplane. You're looking minimum of $5,000 or $6,000. But, you know, like I told people, say, oh, it costs too much, Well, I have other hobbies that, you know, go buy a fishing boat. I mean,
Yeah.
depends on what you want to do.
Depends on where your priorities are.
That's exactly right.
Anything that's fun.
Yeah.
Cost your money.
I haven't found out how to get them to pay you to do it.
Joy.
Yes. Yes.
Is it part of the game plan, Jesse?
So that's where I'm at with that. And you guys have any questions for me? or anything?
I think it's time to move ahead there.
Okay. Well, we always appreciate your support, and the county commission's always been supportive, and we try and be an open book with you, and we, like I say, never hesitate to ask questions. So.
Just offhand, and you may not recall, for some of the new guys, you got approximate number of how many students we've had that's gone through this program that have, some of them I know went on a couple commercial flight pilots and so forth, so.
I really would hate to even guess.
I know 3 or 4 that I just know of.
Yeah.
Good opportunity for them
It is.
right here.
Yeah, and, you know, even if they do not go on to be a commercial pilot, We had a young lady that got her pilot's license through the program, and she applied for a job, or maybe it's for schooling, I don't remember, when she was 18, 19 years old, and it was for a job. And the gentleman said, "You have your pilot's license?" "Yeah, I got it in high school." She got the job because it showed she had commitment, and, you know, and she did. So it was we're glad to hear stories like that.
You don't have a program like this for old people, do you?
Senior discount.
Well, I can ask
You were
for it.
here shortly before the project on the runway was totally complete. But the final project, everything worked out to your specifications and
Yes,
requirements. Wasn't any surprises on the tail end? We haven't heard anything since the very, very tail end.
right, and you will probably hear something here within 3 weeks because the final painting has not been completed. It is supposed to start tomorrow morning.
I'm just curious how that
Yeah.
final deal.
We had one change order that was significant, some dirt work to the east side of the runway. It was there one day, and it was higher than the elevation of the runway, and they said that can't be within so many feet. Well, it's been that way 30 years, but they funded it other than 10%, and our portion was $3,000. Well, we just used that out of the general fund. You know, I didn't want to come ask you for $3,000, but it was $30,000, or give or take, right in there. So, but they wanted it done, and since they wanted it done, they said, "No, we will fund 90% of that." So they just made it into a change order and pushed it through.
Because up until that time, you didn't have any change orders at all,
Mhm.
if I recall.
No, it went really well.
And that really surprises, because on that big a project, you're normally gonna have some.
Idecker, the company that done the project, they were on top of stuff. But we're hoping to have the painting done this week, so we'll be closed Tuesday through Friday. And then I will be able to finalize everything out and give you guys a report of where every dollar went, so.
Why so long in the painting? Rain or?
We ran into weather last fall, and then this spring, just been hard to get that company there. And in fact, last week, I talked to the engineers and I said, we're ready to move on. Decker's gonna have to find somebody else, and boom. They also called Friday and said they'd be here Tuesday, which doesn't give us much notice to close the runway, but we just want it done a little bit, so.
Any other questions?
Well, I will get out of your hair. I appreciate you guys' support, and with your blessing, I think I will inform my commissioners that you guys are in favor and maybe we can move forward with this.
I haven't heard a nay, so.
Well, thank you very much, guys.
Thank you.
You appreciate it.
Thanks, Jeff.
Thank you.
See ya.
Then we're running a little bit ahead. We'll take a break.
Yes, okay, sorry.
I missed the consent agenda for the mortgage release, like we had a town address 151 Cumberland, and they said that couldn't possibly be the address.
100 block of Cumberland doesn't exist.
Oh, okay. Yeah, I wonder if it's in, well, I know where it is, but I can't remember. I'll call
So maybe it's just like an extra one or something.
Sorry about that. Okay, so we'll just do that next time.
I was looking at that in Bob Brothers, that had to be down by the river or something.
Yeah,
That-
it does,
that-
but it's missing a 0 or 1 or something.
Yeah.
Sorry about that. You understand? Yeah, time to apply some time. No.
We'll see how the day's going. I'm just going from here to
Yeah,
Bobby.
that's okay, just sometime.
Okay.
And I don't know if you want to. You guys can pass it around.
We're on break. In regards to your conversation about the housing done by the,
I think that's now what I said, Tom, too.
Okay,
Just give them kind of an update on that, so.
so she owned everything?
um,
I mean, there's tractors down there.
Yeah.
Stuff of value that, I mean, I would be all in for, landfill, but
Yeah, if you want to stop by, I can kind of show you the map and stuff and we can.
yeah, I drove through there, so. It's kind of property, but.
Yeah, I think Lorraine is probably okay with, she knows what I'm gonna do. I have got her to agree to the 3 at least, but, there is a shed back there. And, wood shed
Off back in there, there's a, 1, 2,
with the red one.
yeah,
Try to get that modular out there too.
pardon me.
I'm gonna try to get the modular. That's one of them, and then the 2 houses.
Right. So I guess what I'm saying is, I mean,
There is a tractor
if
there.
they can't, well, I mean, that metal barn back there is.
Yeah, we want to keep that.
Substantial value, I mean.
Yeah,
I
she
guess what I'm
wanted-
saying, if they're. I guess my thought is, where does it go after? They're gone.
Yes.
This stuff.
I just wanted to get the hazards, the
Oh, yeah.
hazards around, which would be the modular and the 2 houses. And then the sheds were there. She probably maintained those and, had them, I'm assuming some of her stuff is in there, possibly, I don't know what's in there, I didn't really look. And I don't know if the little brown shed is a new one, I don't know.
I just wondered. But no, let's see what he says, but.
Okay, and you can stop down, I got a couple of things I can show you on it.
How are you, Lane?
I'm doing well, good morning.
Rhonda just came to fix mine, so that's the addresser. Both of us have got questions.
Yeah.
All right, well, I'll get you this.
No.
I heard
I had it on Zillow for, I got some land off of it, which
Probably
then.
is,
I think that, yeah, so now I gotta get my little K Street done, and then I can get it on the market.
Yes, yes. I heard about that one. I can't say I went by and saw it, but I've heard. You guys got another one. Well, the metal
Looks like
building.
the same one.
No, oh, well, the metal building is not.
I was gonna say.
Okay.
I mentioned her.
Oh, okay.
That makes sense, because when I asked her, and she said, Tanya knows them, and she-
Well, again, it won't.
So,
May just
property
ended
moving?
last week, so,
It is.
So she's still learning.
yeah, should probably
I
got.
got my
Well-
lots out here, I've got some lots out by the swimming pool, I have that
Signature, but.
half lot.
Yeah.
I've had a lot of inquiries about it.
I thought the last time I was out there, I think I just did this correspondence. Was
In the process of
trying to do
transfer.
is like make that right for the
Wait.
correspondence.
So now
That's all
you're
you
doing
can
it,
do.
because you're retiring.
Like
Is
you're-
that right? Is that right?
Yeah.
Which is
Oh,
great, that way you're better. But
and then, so are you?
that's why it's helpful for me.
Oh, yeah.
Well, that's what it is, we got that. There's nowhere you can pull some money
Yeah,
from.
little, been working on it for about a
You want me
year.
to try to get a hold of Tom Dawson and see how much?
That's good that you get to retirement and enjoy it. I'm waiting to.
Yes, oh, well, yes.
No kidding.
But still a year.
Yeah, we still got that.
Still,
Yeah, you got
not too.
And Ron's gonna get us the correct address on that.
Yeah.
That was just really looking so much better. Oh, that just, it used to be really a nice shed place. And then just got overgrown and now it's just looking so much better. So it's great.
It's been a challenge.
Yeah.
Yeah, got a lot of animals, kids,
Oh, yeah.
little babies, she likes animals.
Those pictures, that's all one location.
Yeah, it's up on.
So you try and do all that in front of the animals.
Oh.
But it's all good.
Yeah.
It's all good. What was really was
Just north of
surprising
there.
and fun was how cold it got. Negative 13 degrees or something. You don't run into that too often.
No.
It's about.
You're gonna put a house back there, or a structure back.
I don't.
Yeah, that's really good.
Baby chickens, yeah, and then I had little heaters for
That's
water
good.
for the chickens.
I'll put a structure back.
Well, survived. I was amazed. I'm like, man, as cold as it is, it's just happy to do it.
That's great.
They did.
Budget request is like that one.
Well, I see you go by there occasionally. I guess that's on your way.
I know, sometimes I cut off and go down that way.
Yeah.
Why?
Yeah.
when did I get on the road and put my good stuff down? It's so dusty.
The dust control?
Yes.
You paid for it. Well, we actually have it, scheduled this week.
Oh, great. Or the trucks start rolling down. I mean, I know that doesn't help, but it's like, oh, that's so dusty. My husband said we should have like backed a little further off the road. And I said, no, I know, but we're trying to kind of line up with the other houses, and I'm trying to city fines.
It's under 10:15.
Yeah. Yeah, it's, but, we got like 40,000 gallons of can.
Yeah.
So Jefferson's granted that. It's a receipt.
Well, yeah. And, that's just, that's over, I think it's over 30 some miles.
That's
What
what
it works out to.
So it's not.
Yep, that's all I cover. I know everybody wants theirs first.
Well, it tells you a little bit about all the folks that are, wanting it. There's quite a few folks out in Mountain County that want it. So we
Absolutely.
got 76 locations.
Oh, wow, that's great.
Executive sessions.
Yeah, it's quite a few. We're just counting up here.
3 or 4 of them per hour.
No, it's not that.
Yeah, 7 miles. 7 miles away down. Now it really gets busy for us. When the rain stops.
Through all my stuff.
Wonderful.
Reorganize it.
You want it
I
all?
meant to go through all my stuff and reorganize it. It just didn't, so.
Starting to pile.
I used to,
Probably be nice to be back up.
I could file it.
Yeah. Nice to be back up there and move this new problem coming down. Okay, we are back. You break?
Angela's not here yet. We need her here.
I don't think we have to.
No.
I didn't know if we'll be doing any motions, so no.
So we're
For
on
on
from the housing authority.
I have 2 things to talk to you about. I have the housing pictures kind of going around if you want to share it and make up enough for everybody, but actually see. The 412 South Fourth there, the housing authority has purchased that building. You can kind of see, we've already started doing a little bit of work on it and everything, cleaning it up and everything. Right now, we're checking out the structure to see if it's savable. There's 3 apartments in there, 2 2-bedrooms and 1 1-bedroom. I'm gonna see if we can save it. So I've got the basement people coming to look at that and different things to see, if we can. If we can, then we'll probably demolish it and then have a nice lot there for sale. So I was wondering,
Where you talking? I don't have your picture.
Oh, Don, can you
Hang
push-
a second.
or, yeah. somebody-
Okay.
All right,
Who do you
So
want?
I look at, someone look at.
It's gonna be before and after a little bit so far what I've done, but just kind of trees and make it look a little bit better on the highway there. But I have a lot of work to do to save it, so that's why I don't know for sure. So I was wondering if you,
412 South Fourth.
yes, right there off the highway, and the houses that I did purchase that. So I'd like to, see about if I could get, waiving of the landfill fees, of course. I have 2 little sheds in the back that definitely need to come down. And, if I decide to demo the whole project, then I'm wondering if you guys would waive it for us.
I would. be in favor of waiving landfill fees for sure.
Yeah, I have no problem with waiving landfill fees, no matter what.
Yes.
Have you got any projected cost on
Actually, I just got it first,
Okay.
so, I have started, I did want to kind of clean up and kind of see where I was at and everything, and, I do not know for sure yet. That's what we've got to see, is this feasible, do they keep and try to, I mean, as we all know, we need more housing, of course, but, will I be able to make it work for 3 apartments and everything, so. So do you?
Good luck
want
with
to make a
that.
motion on that?
So I guess we need a motion to waive the landfill fees on this. 412 South 4.
Yeah, but since we're in this, let me go ahead, landfill fee and last question.
No, if you want.
If you're talking, making apartments,
They're already apartments,
like already, and you're just talking of either
rehabbing them, same.
rehabbing the existing. I don't recall where the parking is. Is it on the north side?
Well,
At the alley?
there's 2 little sheds, I'm not sure where they parked before, but there's 2 like little sheds back there. I'd like to clear that all out and then gravel that for parking spaces.
Okay,
It's off the alley,
if you were doing apartments, you definitely want.
Yes.
Because
I
it's
know.
actually 2 major, the highway and then you was a fairly
Yeah,
busy
it
street.
is.
So
Exactly.
I think
Right.
a lot of times they used to just pull off here.
See, and that's why I didn't know whether they parked on the south side or not. I don't recall because it's been vacant for a while, so. But I would like to take out the 2 little sheds for sure and then make gravel that and make some nice parking in there. So it will be off the busy road, so.
Yeah, it's been so long, I couldn't tell you where they parked either. I think it was out back.
I think so too, probably.
Some of them, I think there was you.
This one was kind of like a little shelter, like I think maybe they maybe pulled in there, but I don't know.
Anyway, as long as you look, it sounds like you're looking at space for the parking, that would be the thing.
Absolutely, because that's my
If the
question.
county
too. I
would
was
be
like,
responsible for.
A motion to waive landfill fees on this project.
I'll make the motion.
Kenneth made the motion.
Second.
Jesse seconded. Any further discussion? All in favor, say aye.
Aye.
Aye, motion passes 5-0.
And I'll keep you up to date on everything.
Awesome.
Before and out of pictures. And then I have my budget. I think you all have had a copy of that, put in your packet and stuff. On the regular general, budget, I have not changed anything, from last year really. I don't know if you have any questions on it. I am definitely, of course, need the match money to continue doing the preservation grant, which is where we fix up homes in our counties that are low, very low, rehab and stuff. And then, of course, I'm still trying to get another grant for moderate income housing down in Leroy. I'm working on that town right now, and then hopefully just continue to do some, that will be rentals, at this time.
Where would you get the money for this 4th Street project if you can rehab it?
Well, if we keep it, then it just comes out of our general, we'll have to, have to pinch my pennies, keep pinching my pennies, because I figure we can kind of work on that as we go. So I can kind of use some of my, general funds. But if we, make it into vacant lot, then I'll switch it over to the building fund, which is the revolving building fund that they have set up already.
What's the chances of getting that $100,000 grant?
Well, they are trying, when I visited with them, COVID has really messed everything up, you know. They have a new director in there that, for the USDA and Resource Council. A resource center out there and speak up for our grant. I can't even talk today, but, and they have a new director up there. So I haven't met her like face to face like I did before when Fred Bentley was there and everything. And so, we're kind of do a lot of talking over the phone. Well, you don't really get to know someone, you know, and everything. And so she had some questions on my last grant. I kind of portrayed it, because of course the housing authority is going to be the one that's administering it, because we're the one that has the experience versus the city. because they didn't want to go through all the hoops and figure all that out and everything. So working on that, you know, she's like, well, we're trying to get one in each different town because, you know, they want to spread it out all over Kansas and everything, and I understand that. But I'm trying to focus it more on just Leroy with us administering it. And I think maybe my chances might be a little bit better. I'm hoping, I don't know. It's just it's cutthroat, you know, any grant is, so I just have to try to hope I've got the best application in there, or one of the best, so to get it. But, I definitely spoke with her. I said, how can I improve my grant? And she gave me some pointers. And so I'm gonna like actually try to have a conference call with her once she gets it and say, hey, you know, and does it look like I'm missing anything and stuff like that, so. And she said ours is good. It's just that they wanted to try to spread out and do some other towns. So that's why I'm gonna focus more on Leroy versus, I think I pushed it more Coffee County, which we already had one here, so I'm gonna try that avenue.
Good luck.
Thank you. I hope I get it.
Anything else?
At the end, if you don't have any other questions on that,
I'm sorry.
I had put in there, because we could kind of kick this around, on a code inspector. I kind of just put some numbers together. I'm not 100% sure that this is exactly gonna fit the bill. I know that there's probably not one person that can do all of what we would want. Right now, when we are building structures or rehabbing them, we go out after a building inspector, code inspector, to make sure our contractors are staying in line and everything. I know some things, you know, in the past have been built in our areas that probably have not been quite up to code, and no one's kind of been there kind of big brother in the world watching over just to make sure they're doing it right and everything. And so this has been kind of, I've had realtors, I've had lots of people actually contact me. I don't know if any of you have had these people contact you, but asking, you know, about trying to get some, you know, some kind of, you know, responsibility for building and everything in the residential and, you know, and also probably we could even do the downtown areas and things like that. So my idea was kind of like, I know the number is kind of high, but, you know, I think we talked about maybe the cities, if they could kind of kick in, but I'm not sure how you all want to structure it either. And I also get calls for, you know, like landlords are not keeping their properties up, things like that. I know the cities kind of maintain the grass and things like that. So there's like a big, you know, open area here that the cities and maybe the county could work together on getting someone to, you know, fit whatever we need. But I needed to kind of start somewhere and see if you guys are even interested in us pursuing that. I've been working with Bobby Skipper, and talking to him about where we could put, you know, a person. And I have reached out to other towns, I will tell you that, like Anderson County, and I said, you know, would you have a person? Yes, they had a person. So I contacted them, and would they want to like co-op with us? Because I thought that'd be the best option, you know, just have them here as needed. He says, I'm way too busy. I cannot go anywhere else. I saw where New Strong was running a code. I think it was more enforcement, but it was more towards the grass and things like that. I checked with them. Woodson County had the same thing. I checked with them just to see what kind of person they were getting. So I don't know how you guys feel about that. And, you know, I just thought maybe we could get some discussion on that. And you may need a little time to think about it. I don't know, so.
Not me. I'm all for it. The big, you know, the terminology, a lighter terminology would be code services, if you will.
Yes.
And we spoke of it before, and in some of the meetings I've attended with you and even the previous economic development director, I mean, even with some of the cities we had meetings with, some of the city of Burlington at that time was on board about making a contribution toward this individual. I don't know where you spoke to Leroy or Waverly or any of the other cities about that, but the thought of it being would be, you know, just like the infrastructure money, they all get a percentage, if you will. How the breakdown goes, I don't know, but I mean, the kickback can kind of be the same toward this individual. That way, if we share with all the cities, within the county as well as within the county for code services, so.
I think, I don't know if I'm necessarily against it, but I think one of the problems is you're gonna have to have every city on board with it. And actually, the county doesn't have a lot of codes. We have sewer codes and stuff, but we don't have nuisance codes and those kind of things. So I think if we're going to go into that, I think the county probably needs to, I mean, nuisance structures, you know, we need to kind of see where we're at. And if we're going to do it, then we need to determine just what we want this person to do instead of just jumping into it and say, yeah, we need a code inspector and here it is. Because if a city is not bought into it, I don't think that person would have authority to go into that city and do that. But we can't. I know the county officers cannot enforce city codes now, so.
Right.
I think it might be a good idea, but I think there's a lot of things that need to be straightened out before we jump into it. So I think it's good to take and think about it and determine just where we want to go with it.
Right, and I have no problem speaking to the cities and seeing, I was thinking about it beforehand, but then I thought I really wanted to talk to you guys because I'm gonna need your help with this. And so that's why I wanted to talk with you, and I can listen back with more information.
I know this is one of the areas that Tom's been interested in ever since he's been on the board, so.
It definitely is.
Probably needs, and I'm not saying I'd be in favor or not in favor of, but I feel like there needs to be more discovery. And I'm sure there's probably a place for it. Is Coffee County the right place? I don't know. If you have the right individual, probably some value if you come to the table.
There is a United
It is an
Building,
unknown to me, I mean, a little bit of unknown.
there is a United Building Code in which I think the city of Burlington, and I could be wrong on this, I'm pretty sure that's when you come get a building permit, I mean, that you're adhered to the United Building Code's latest edition, if you will. Now, Wayne might be able to answer, I'm sure when they get a building permit in the county, there is no particular code that they have to adhere by.
It's a zoning permit, so it's not a building.
In a story, so.
Yep.
Adopting UBC, United Building Code Manual 1997 edition or whatever, would not be that hard to do. As well as the building code manual, there is a property maintenance code, which is a nationwide thing as well. All you have to do is adopt those two items and it's kind of a done deal.
At least you got something to go off of.
Yes, and then you find a person to.
Start with a piece of it, and then you're gonna have to get more
Yeah,
training, of course,
yeah.
too.
Finding that individual that's qualified in electrical as well as plumbing is what it's gonna be tough to do. So, and that's where I kind of backed off a little bit, thought, okay, just code services to, I think property maintenance code would be advantageous, and then maybe the rest could come with.
And I know there's these federal code deals, but from my experience, they don't always fit the community. We need a code that fits this community.
Why would not the United Building Code fit this community? You want your house built just as well as the one in New York?
And expect us to do it.
I don't want mine built like the ones in New York.
Well, just as well. You want your house built just as well as.
I don't know how well they're built.
A state inspector, I don't know. There's a code you're supposed to build by, and that's the way it ought to be. And there's a code as well as property maintenance that you should adhere by, and that's what it should be.
I think they're good codes. Sometimes codes are good, but I don't think it's something that, I think we need to do a little research and make things work to do it. And I'm not saying I'm against it, but I don't want to just jump into it. And it seems like lately that we've done a lot of things and then we turned around and had to redo them and redo them and redo them. And I don't want to do that. I think we need to start determine where we're at and where we want to go before we do it. So.
Well, I agree, it's not to be taken lightly, but I think Wade's got something he wants to add.
I'll just say behind the scenes, I've been working with Maryland on letters to members of the community regarding nuisance complaints, which is not exactly the same thing, but it's similar. And it deals with nuisance property under KSA 65-159, which gives the health department the authority to direct county, property owners to take care of issues with their property that deal with sources of filth, causes of sickness, and those letters have recently gone out. There's a number of property owners within the county. One thing, when I got here, for me to follow through on the county attorney side, if someone fails to follow through and take care of their property as requested, I wanted to make sure there was a complainant that could be identified and come in, and if they had to testify in the courtroom, should that be required, because there are criminal penalties that follow through, or there are penalties, including fines and different things for properties that they're put on notice and they do not comply to take care of whatever the issue is. So there were about 6 to 10 letters that went out throughout the county for different property owners throughout the county to be put on notice that their property is considered a nuisance, what the issue was, and that they needed to correct it, or enforcement action would be taken. Several of those landowners have replied and said they have a plan put in place. I've worked with Maryland to see that plan meets some sort of timeline for those issues to be remedied, and that's really all that's requested. We don't want to take enforcement action unless it's absolutely necessary. But there are nuisance properties throughout the county, and they need to be addressed, and we're trying to do that.
I'm so sorry. I was trying to catch the conversation in the right place, so it didn't go on to another topic. But what Mr. Commissioner Bob was speaking about, that the effort to bring in a code inspector, code officer, code services officer, and the efforts of the county attorney have to fit with the tailored taste of each individual city. So we are doing that currently. We're out talking to the individual cities to identify what's important to them in the code services world. Also in the nuisance world, the back end. So we don't have any code on the county level. Most cities don't. Burlington has a good bit in enforcement of nuisance. But currently where we're at, our attorney's working off of the sanitation statutes within the Code of Kansas, because we don't have anything adopted locally via ordinance. In this broader effort, through further discussion, we would at some point come to the county and ask you to adopt codes that give teeth to the enforcement process for code services, where an officer might be able to go out and be more effective than pursuing them under sanitation statutes.
And the philosophy of it for me is that you don't need one of Sheriff Johnson's persons running around the county trying to figure this out. Or City of Burlington police officer running around trying to pick on her. I'm probably gonna word it wrong. Figure out who needs attention and who doesn't. So, I mean, if you have an individual, that's what their job is, that's what their job is.
And in addition to everything that was just said, there is also the broader effort, comprehensive effort, where regulations of zoning and for the city of Burlington may conflict with the county's existing set of regulations, specifically what we consider our jurisdiction versus what Burlington considers our jurisdiction. If they created a map, both of those are different today. So we want to work with Burlington to become more efficient and have common understandings across all aspects of what is planning, zoning, and code enforcement.
Thank you.
And on latest part 2, I have let them know that, and Maryland's been in contact with me too on, they can contact us about waiving landfill fees and stuff like that. We currently have not got any response on that. So hopefully we will soon and get some of that cleaned up. So, any other questions on the motion?
No, while you're sitting here, I believe we got the address corrected though. To 515 Cumberland Street.
Great, that sounds good.
So, which makes more sense. So upon the request of the Coffee County Housing Authority Board, move to authorize and direct the chairman to sign the real estate mortgage release, acknowledging satisfaction in full debt secured by Michael L. Crooks, Ricky L. Crooks, and Carolyn S. Crooks. Common address is 515 Cumberland Street in Burlington, Kansas. And like I say again, it's a big list of description of the property. So with that being in my district, I'll also move.
All second.
Any further discussion? All in favor, say aye.
Aye.
Motion passes 5-0. Thank you.
Rhonda, can I ask a question? Who is this disaster relief,
Eric, you've got some clarification for us on this wage thing?
I hope so.
If we'll go ahead and take care of that, if you don't mind. That way you can move on.
I apologize for my voice. Got taken down a notch last week with cold and still fighting it, so. Not COVID, not COVID. So, you had a question on, pay hire, rate of pay that we hired someone at, is that correct?
Correct.
All right, and that's for, a recent jail position that we filled. The individual that we hired, came to us with 17 years of experience in corrections, including her last assignment, in the Arizona Department of Corrections. She had 17 years total with the Arizona Department of Corrections. She held a position of lieutenant, shift lieutenant. She was also a state certified, Arizona state certified sniper, tactical team member, and a firearms instructor. She came to us with a lot of qualifications and a great deal of experience. And we didn't want to disrespect that idea, but we also looked at those who held a similar amount of time. And then regarded the idea that there are those that have been with us for a while and we're going to put her above them, but we want to get her at a good competitive level. So that's where we came up with what we did, 2512. Sorry, 1898, which is at the pay scale of 2512.
Any questions on that?
No, to me, that's the exclamation we needed to justify the new starting wage at 2512.
Absolutely.
You know, my understanding is if our, the department heads can start in the first, 1, 2, 3, maybe even 4 and 5. I don't remember the exact details, but to get beyond that, we need to have, we need to have an explanation of why they started at the level they did. It sounds like this person is very, very well qualified to be at that level.
We feel so.
Thank you.
Thank
Thank you very much.
Thank you.
So we'll just get it off our books while we're here. Move to authorize and direct the chairman to sign the Coffee County payroll notice for Lisa Ryan, new hire, subject to regular IPP, Sheriff's Office jailer classification 25-12, wage $18.98, effective 5/27/21.
Also moved.
John's moved.
All second.
Tim seconded. Any further discussion? All in favor, say aye.
Aye.
Motion passes 5-0. Okay. Wayne's gonna step back and let Jeremy take the test.
Okay. I appreciate that.
That means he's gonna get long-winded on us later.
We can
Know me too well.
we can take care of that. Tom.
Well, good morning, everybody. Yeah, just appreciate you guys letting us come back and go over all of our actual income statements with you guys so that you can hopefully understand where we're coming from a little bit better. Before we jump into the actual numbers, I just wanted to reiterate exactly what it was that we were asking last week, so that there's no confusion on that. I did want to make sure that everybody did understand that the proposal that we're making was based off of the hospital's needs and our forecast that we're making for the 2022 fiscal year. And hopefully at the end of this, by the time we go through all of our actual income statements, we'll be able to answer any questions that you guys might have, and that you can trust that the numbers are what they say that they are. And so with that, I will just reiterate the recap from our request. Currently, the hospital's at 1.83 mils, which the last that I had equated to 1.019 million. We got that for both the hospital and the ambulance services for last year. The proposal is that we were asking to increase our tax revenue by the same amount that we received from the hospital side last year, another 1.019 million, which would total 3.059 for the 2022 year. So I hope if that was confusing last week, that answers what we were asking for. You guys should have in front of you a budget narrative, as well as the Coffee County System budget summary. And that shows the 2018 all the way up through the actual 2021. And we put those side by side just so that we can go through those each year by year to make sure that you guys understand where we were coming from pre-COVID versus during COVID, and then what we're looking at post-COVID.
Did you give that to us before?
Yes.
He was laying on the desk when I started.
Okay, I didn't have anything.
You got too many papers.
I didn't have anything laying here.
Yes, this being in the basement, we're with no filing cabinet.
Yeah.
I'm unorganized. I
I
apologize.
don't think I have that. You guys have a
It
copy?
should be 3 papers. There were had a whole bunch of coffee health systems.
And then the third one was our actual income statement for 2021. It shows our year-to-date as well as our budget and our prior year. So I would ask that Juanita come up and we can go through these together, so that if there's any questions specific to what our actuals are, that we can answer those here today and hopefully move forward. So Juanita, oh, there you go.
Good. Hi, everyone. I did.
Okay.
And so I think we provided a little bit more detail because the county form itself is finding buckets for all of these things to fit into those line items. I really, if you haven't had a chance to read the narrative, it sounded like maybe you haven't. I'll kind of explain what this sheet is with the 4 columns showing the 3 actual years. And then our annual budget is calendar year, and then fast forwarding to the county 2022 budget. So in doing so, just kind of a pre-overview. Before, when we stood up here, we were unknown last year of where COVID was going to go. We had a laundry list of assets for the infrastructure to keep going and offer all the services that we offer. And in doing so and changing to critical access hospital, I just kind of want to remind us, if you were around then, when we went to critical access, it was to try to negate and even out all of those hills and valleys that the hospital was experiencing under a PPS atmosphere. And so in my overview, I tried to explain each column, kind of a pre-COVID at 2019, looking down, all the way down to the bottom. When you get to net operating, that's before any county funding. And then our county funding coming in, plus a few small donations and grants that came in, getting us to the negative 12,550. That's where we were pre-COVID. Then fast forward to COVID times, you will see, wow, our gross patient revenue went down $1 million. When you come down to the bottom line, pre-county funding, we had the loss of 3.7 million, which sounds extraordinary, but really, I was very impressed with our team and how we managed, because we were closed basically 2 months solid. And then that last quarter of last year rebounded immensely. It was very taxing, but then we were also managed to procure a lot of outside government grants and some PPP funding for our payroll that helped us go as a going concern without having to come to the county and rely on county resources. And so that kind of shows that picture. Well, yes, it shows we had a $3.7 million income a lot of that income was tagged to certain COVID-related expenses that we're expending now in 2021 that they allowed us to carry over those funds and do. So in my narrative on that front page, if you go down to non-operating revenue, I really tried to point out non-repeatable income. So while that does look great, and we are very fortunate that our government and our county has supported us through these hard times, we still are going to be short now this coming year in fighting our low labor, as we talked about. The labor market's very tough right now. We're having to spend a lot of resources to procure the talent that it takes clinically. And our expenses and supplies, the inflation rate exponentially is going up faster than we can procure revenue. And that mix alone, plus no extra government funding past 6:30 of this month, we have a kind of a little storm going that we know we're going to have to manage through. And I think that was hard for us to really show that on your form the last time of why you kind of questioned, why are you showing your revenue lower? We can't just increase our revenue. And so I tried to also spell that under the bullet point revenue, talking about insurance and how they pay us on a map. And so it doesn't matter if I increase my charge, most times I'm still going to get the same rate. And I'm writing off the contractual difference. And really that's passing some along, and we have done a little bit of that, but not a lot of it, because we can't pass it along to our patients at this time. And so that storm there is showing that lopsided movement. I hope that helps explain that a little bit from an organizational, we have a lot of legs and businesses on our business side that we can't just stop with services, because they're not making the money, and we don't want to do that.
Yeah.
And that's kind of where we were.
And last week it was brought up about there was a decrease in revenue from 2021 to our budgeted of 2022. And when we went back and looked at that, when we look at without those dollars in there for COVID, because those numbers for 21 and 20 have about $5.5 million each year in there for COVID relief funds. So if we're not looking at repeating those dollars for COVID, we actually increased our budget for 22 from pre-COVID of the year 2019 of the revenue that we had in that year. So wanted to make sure that everybody knew that we weren't decreasing our revenue, we're actually increasing it. And we have seen some growth. Either somebody had mentioned, I can't remember who it was last week, that, I think it might have been Dawn, that we increase charges periodically from year to year. Maybe it's a couple of percent, just the same way as like wages increase, things like that. And so those are some of the reasons why our revenue does show an increase, is because you do have a little bit of an increase in those charges. Like Juanita said, it doesn't necessarily mean that we're going to get paid anymore, but we do try to keep up with those few insurances that are still out there that pay based off a percentage of your charges, instead of those like Blue Cross Blue Shield, which is our largest payer, just pays us what they know that we can accept. So.
Jeremy, this column, this page here, there's a huge amount of information here that you're not going to be able
There is, yeah.
talk about. There's a lot of stuff there.
Yeah.
You take a year to date, April 21st, and year to budget, currently your income is above your budget, and you're $1.2 million above the prior year, April 20. So it appears that 21, first 4 months, is running ahead of a year ago and running ahead of budget on the income side. I haven't got that far down to the expenses, but is there any COVID money in that 13.5 million?
No.
And that makes sense.
But looking at this, it appears that your income is running 10% above projection and 10% above last year.
Yeah.
And I'm not trying to throw red carpet in there.
No, it should.
But this is
Nobody's supposed
right
to hospital anymore
where,
than I do, but
Yeah.
this is right at the point last year when we started closing down.
yeah.
So that, it is misleading on here because we started closing down and shutting down and doing all of the COVID precautions that we needed to do, which has immensely affected our income.
But most of that wouldn't have taken place until after April.
Right.
Chances
So
are.
that's the bad thing about this sheet. And the other side of that coin is this year, if you fast forward to looking at this year, we are seeing a lot more charity care and bad debt expense.
I was gonna, that was a question, we never see bad debt expense. Of course, I worked in business 50 years, I know bad debt's there.
Right.
How many dollars do you write
It is a
off?
line item on this, on your form with your actual 18, 19, and 20, and then the budget 2021. You can see I show our charity care should double. It's in the middle of the row under gross patient revenue. We start contraction.
$1 million right on that.
And then our bad debt. Now you'll see from 2018, I do want to point out your bad debt line. We put a lot of things in place on self-pay, and you've heard, you know, the hospital's putting this in place and that in place. We have outside loans for people to take. We have internal 3-year non-interest bearing loans to help them bridge that gap and pay their bills. That really drove down our bad debt from 18 to 20.
We kind of put that in place a couple of years ago, or maybe 3 years ago, that had a dramatic impact of bringing the bad debt
Right,
situation down.
well, we did, yeah, 14 was huge, and I came aboard in 15, and we started putting in all of these programs to really help this situation, and help our patients too, manage their debt. Yeah, but unfortunately, our economy's not doing as well, and there are some things out there that are, we're seeing a lot more charity care accepted applications and some bad debt. So we have to budget for that.
Well, it's a budget item.
Yep.
Like Don said, I know there's a lot of information there, but I want to be here to answer any questions that you guys might have about how we came up to the need, because we do strongly feel that if the projections that we have is accurate, that we will have a significant loss. And what that's doing is it's not allowing the hospital to be proactive, really. It's not allowing us to put any money towards capital. What we typically do during this process is we take our allocated money that's tax revenue, and right off the bat, we start allocating items to that money that we receive. And by the time we put all of that money towards items that it's listed towards, we only have $370,000 left to put towards capital each year, which is a very small number for a hospital our size.
You know, and I don't mean to be doing the talking, but you know, we know what went through before Scott Independence. We heard that about 2 years ago or 3 years ago, whenever. We know what Iowa and Garnett's going through now, and hopefully it's the right case for them. But, and out of total, no disrespect, but because the county's got deep pockets, the challenge for me is maybe reduce expenses and yet still provide the service. Is there any room for that? You know, I'm trying to say, I'm totally no disrespect.
Yeah,
there's always a challenge there to reduce expense, in my mind.
Right.
To reduce expenses.
Yes, I think
I've dealt with that all my life. You reduced expenses to make the tail end work.
Yeah.
Maybe not every year of work.
Right.
But you have to make most of your work or you couldn't stay in business.
Yeah, and that is something Juanita and I have been working on. Of course, not being here very long yet, to come in and start cutting services is probably not my #1 goal. But I think Bob last week had made a comment about, you know, how far is too far, and that probably was in relation maybe more towards satellite clinics or locations surrounding throughout the county. But those things are departmental, and Juanita and I are looking at departmental reports to see which departments are making money, which ones aren't. And then the ones that are not making money, we have to make that determination as to whether we can continue that service. And that's where, you know, some of the times county money does come in, is that we we say we want to continue delivering babies in our county. So some of that money that we get is gonna go towards keeping that department open.
But you can take, with 8 or 10 different departments, however many you got, you may have one department and may be losing a fair amount of money. But yet, the dividends for that people walking into the next department might put it into the plus. It's difficult to evaluate.
Yeah.
Where do you make your reductions?
Sure.
We have a number of job openings now, of clinical people that we have not been able to retain and get to our county, that if we were to close off some of those services, we could definitely absorb them in the hospital clinics. I don't even think we would lay off anybody. Because it takes the same departments out here in this area as it does here. So those synergies are always looked at, and we have people that cross and do that, across departments and cross facilities.
Well, that's a function that needs to be done in a business.
Right,
And
which we
You got
have.
a $40 million business, so those
Mhm.
things have to be done and evaluated.
Mhm.
You guys, Jesse, do you have any questions that need
I would like to
clarified?
see, I would like to see a report of what's making it and what's not.
By department.
I really would.
How many departments do you officially have, Jeremy?
Oh, yeah.
They pretty well operate on their own as such, and you've got department people above them, but.
Yeah. So around 25
Yeah, that many
departments.
individual departments.
When we have our leadership meetings, we have about 25 different departments represented. Of course, there's, like you said, different tiers and levels, but
Don't get me wrong, it's important to have a hospital, it is.
Right.
But if something's not working, you gotta figure something else out, or try to, and we probably don't have the right answer, none of us do, but that's why you're in the position. you're
Right,
in,
yeah.
And she's in the position she's in.
well,
In your business, you have the right answer,
right.
because that's your profession, and what I was in, I think I had the right answers to make decisions, but we're not qualified to handle yours.
And with that, I would say that we have such a talented group of executive leadership at our hospital that, we always talk about, we are kind of on the bubble of being a large hospital, but we're also, in a small community, and so we're considered a critical access community rural hospital. And, with all the hospitals that I've been around, only the large hospitals will employ a CPA as their CFO. The talent that we've got on our nursing level and the experience that they've got is far beyond any critical access hospital that I've been a part of or that I've seen. And I sit on 2 Kansas Hospital Association boards and work with a lot of hospitals and see and hear. And the staff that we've got from top to bottom, we're just very fortunate to have the type of health system that we do. And, I'm not asking for the county to put any money out there that I don't feel is necessary by any means. I'm trying to fulfill the capital needs that the hospital and our health system have.
I guess by statute, we have 10 days, but I know some of these new guys have questions that have never been through this.
Sure.
I don't know, and it might be a Wade question. Can we agree to extend beyond those 10 days so that these guys can get some answers before they vote?
So I'll let Wade answer, but I do think there's probably some, if we're talking about mills and taxes and things like that, we have some deadlines and some things that we need to post in order to meet the statutes for those.
Because I know if we say no, then I think you've got maybe 10 days again to bring us back something else. But I don't want to just up and say no.
Yeah.
To make you do that if there's some kind of, if we can maybe come to an agreement, because I feel it's necessary that these new guys have these questions answered.
Yeah.
I know where I stand on it, but.
Yeah. And I'd be happy to, come back as many times as necessary to answer questions today. But, that's why we're here. I do want to meet the timeline that's necessary though.
Can that report that I asked, can it be sent out via email to the commission to review, to make an answer more timely for turnaround?
You're looking at me, right?
Well, I'm just throwing it out there. I don't know if that's.
I think you can receive things as long as you don't respond.
Right.
So there's no serial.
Right. Well, if I'm asking for information and Tom might not be, if I can receive the information, it makes my vote better or more knowledgeable for the taxpayers, and I don't know why a person could do that.
The only catch on that be if he's asking for information, we're not gonna meet again unless we have a special meeting until next Monday, and that's gonna be within after our 10 days. So that's what I'm asking, is there some way we could you get it to him today? Maybe agree to extend it for a week without all the procedure of telling you no, and then making you go back and
like, Dr. Shell mentioned, we can email that to you guys today. I don't know if you guys break and then come back or how do you do that, but if we email that to you guys today, and we can try to answer any questions that you have after you review that, we can do that as well.
We're probably gonna be here past 12:30.
Yeah.
1 o'clock probably.
So just to clarify, you want that on 2020, or you want 2021 year today through April?
Well, 2020 is gonna be a bad
Comparison.
Right.
So would it be tough to put like 2019?
No, we have the information.
Okay, so you might just throw 19 or 18 on.
Okay.
And that way a person kind of see.
And the report format is just the year-to-date actual versus what we budgeted versus that period last year, so I could do 19, 18 in our 19 budget.
So the year-to-date on the income side is they're far away, so it'd be good to see how the current breakdown is in the last 4 months.
Okay.
Any other clarification on what was presented this morning?
Not for me, they're asking all the questions I was wanting to ask.
Okay.
That's why I'm sitting here in silence, like, out of town, I think.
Jump in anytime, Tom.
Yeah. You guys are doing fine.
I went-
You're asking everything I'd want to ask.
I went back and dug out the 2018-19 actual, and then compared to the budget request came in every year, the numbers don't coincide.
Yeah.
The numbers don't coincide, so it leaves some open questions for us on that part of it.
So
Because
your
18-19
calendar
actual here
year,
don't tie
and
into this.
you're July 1 to June 30th. So you're taking half a year here and half a year here and putting it all in those forms. That's part of the problem.
Yeah.
I'll just throw this out, and I think I threw it out a few years ago, actually, when we gave you the loan, started out that loan, it was mentioned at that time. And to me, it's just food for thought. But you have 1.83 meals, I think you can go up to 3 meals. I sit sometimes and wonder if we wouldn't be better off to increase the hospital's meal levy, another meal, and you guys not be coming in every year and asking for this money.
And that's actually what the request.
What you're
is.
saying.
Yeah.
I sometimes think that might be a better deal.
Yeah.
I mean, we might take a little more slack by doing that now, but we're not gonna be taking it every year.
Right.
And you don't have to come in and beg every year.
Yeah. So I didn't have the actual.
You can establish your own mill levy, correct?
Yeah. So.
And I'm not saying that's the way I jumped right quick, but I didn't realize that was there.
We could definitely go forward and then provide you quarterly updates on how we utilize the funds as well, if that's an easier move today.
The department head breakouts, like for your 25 departments, and just like your salary, Jeremy, your CFO, some other upper management team, is it also prorated down into those department heads on 1/12 each month.
Yes.
So it-
the budget.
Those breakdowns will include the upper management level. That's not directly assigned to them.
Are they in administration only, Juanita, or are they broken?
Some are, like ours would be in administration, but like Dr. Shells would be in the clinics. Our other heads would be in the medical.
So
the nursing
they'd be
side.
someplace in that department.
The total of the departments adds up to the total of the income statement.
And the main reason, hope, is to get some of that cost reimbursed. So anything that's clinical, obviously Medicare's gonna pay a
Right.
higher percentage of
Right.
reimbursement on those.
So you need to recover it somewhat.
Yeah.
Right, you can't recover me, I guess.
I don't have any other questions. I really, really appreciate you coming in.
Yeah.
I know I talked to you on the phone the other day and enjoyed the opportunity to visit with you.
Yeah, me too.
And your openness, that's what I really appreciate. Well, I think you know where I'm at. I mean,
Yeah.
I'm here to support them.
Yeah, I appreciate that. And my goal is to be in front of you guys at least, once a month and talk to you and continue to provide information that is helpful for you guys to know how a hospital's doing.
Any other questions?
The only thing I got this is just my feelings, at the rate the county hospital is going now, I don't feel that they will be able to support the payment back to Coffee County on the loan. I just don't feel that that's something that's ever going to come back to the county taxpayer. And it's already been written in half. It's already been taken down by half.
Right.
Because I think it was 3.5 million, right? And now it's down to 1.5. And it's at a $40,000 loan starting in May of 2022 or something like that.
30,000 something, May 2020.
And it's like $40,000 a month. I think that's.
I think it's 30 now.
Oh, 30,000.
It's 30,
Because it
37
was
rate.
cut in half, the
Right.
payment. yeah.
But I mean, still, I don't think the hospital's in a position to even pay that back at this point in time or going forward. So there's another 1.5 million.
They don't have to pay it back today.
Well, I understand that. Right.
But you gotta set it up as a liability.
Right.
You gotta set those liabilities up.
It's on our balance sheet.
Huh?
It's on our balance
And
sheet.
those liabilities, you gotta keep them in place. That's, the auditors will do that.
But what I'm saying is, it's still not gonna come back to the county.
The only thing,
So with Bob's thinking of raising the mill might help pay that back.
No, very good point then. And the reason I wanted to mention that is that that's why we did the loan, is because obviously statutes didn't allow for certain money to be given. So if you said, come back every month and tell us what you need, you're limited in what you can give us. So we say, well, we need 100,000 this month, the next month we need 100,000. You're unable to do that except in a loan format. So by raising the mill levy, allows you to be more operational. So good point.
So that, what we were asking is, that another 1.8, which would get us another, basically $1 million. And that keeps us under the 6 mills that's allowed between the hospital and the ambulance. We're still in the 5.4 range, I believe.
I don't wanna hold everybody else up on my questions. I mean, we're at a crossroads now. We've got to figure something out. As far as raising the mill or whatever. I don't want my questions she can still send them to me.
Right.
But there's enough people here, I think, that can.
Yeah.
Even if I vote no, it's still gonna go through, So I don't have a problem with continuing on.
Well, it'd just be nice, just kind of for information purposes,
It
on
would,
the request. Just
It's
whether it's gonna make a difference on anybody's decision, I doubt it, but it's something to see.
Just accountability. That's all I'm looking for.
So we'll get that out here when we get back to the hospital.
Awesome.
All right. Thank you, guys.
Thank you, Jeremy.
Yeah.
Thank you, guys.
Thank you. Thank you, Doc.
Oh, you're fine.
Yeah, Wayne.
Okay.
I need a fan.
And so, I'm gonna
allow me until 12:30 until you get some information back?
No, we're not.
No, okay.
They only had us down here for 10 minutes.
And it's
The wiki
expired.
ball, that you can use. Yes. Good morning.
Good morning.
All right, and I will endeavor to try to stay on that schedule, but I know we'll get a little late.
You weren't here, but we went ahead and did the CP two for you.
Oh, great. Okay, then it's just information then at this point.
Yeah.
Special issue check. So. Construction zone. So, I'll have several handouts, so. you get your- The handouts I have are just maps, so you can see what I'm busy about, so that's really what I'm asked to do, so. This one here, I'm just handing out, it's part of construction zone, what amounts to some ditching, here in the city of Burlington. It's on, the south side of Housatonic. As you can see from the map, we've already visited with the city, and, they also agree that this is county's responsibility, something historically we've been taken care of. So the, highlighter or black line, black magic marker line is the area. So just information at this point, what it amounts to, just to let you know that we're working on that this week. So the south side of Housatonic from approximately 10th, clear to Links Road. So just some information there.
Is there an issue on the west side of 16th Street? I call it 16th Street, probably Leans.
Well, yeah, as you can see from those houses, I believe the Anderson's house, there always has been that flat area, right in there on Links. That's been investigated multiple times. And even further north, you might not be able to see all that, Tom, but there's up to the next intersection, basically up north on the next intersection, there's some drainage, some history that goes with that as well. Not too much that we can do. We went through there. I believe there's been some pipes replaced. There has also been some ditching done in that area. But from that location right at the Housatonic, I believe you're going to find it's just flat in that location, very difficult to drain.
I was thinking further north toward Burke's house.
Yeah. And that's the other one. So at Burke's house, what there is a drainage way that actually runs back to the west. And there's a pond just south of it. And so actually there was an agreement many years ago, and that drainage way was built and to actually drain into that pond. That was part of it.
Excuse me. Sorry.
It just has been maintained.
You know, we discussed this a few years ago and came to the conclusion there's really not a lot that can be done there.
No.
I just noticed it holds a lot of water. When you get a lot of rain, of course, everything holds water, but. Didn't know.
So that's one of the things.
So you're gonna clean the ditches out on the south side?
Yes, sir. Yeah. So that's
Where's the dirt going to?
landfill.
We'll go landfill.
Landfill at this point. Also for construction zone, just for information, we'll be starting our magnesium chloride, our dust control for this week. And just to give you an idea, we have 76 locations throughout the county this year. Then with that as well, there are times that we have some of the extra magnesium chloride. And so what we've done in the past is the extra magnesium just went to the shop and we were able to utilize it there. But what I'd like to have is just to let you know if you agree with. Basically, this is at the fairgrounds, so the magic marker is the area that is actually the RV parking area. As you're familiar with that location. so the RV parking area. And so we visited with the city, and the city's okay with it. If you do not object, we'd like to take that extra magnesium that basically is just left over in the tanker and place that out at the fairgrounds. So we have assisted with, did I get you that now? Okay. We have assisted with basically a calcium chloride product that we have in the tanks that we mostly use for snow and ice removal, but we don't carry magnesium chloride, we do carry calcium chloride. Calcium chloride doesn't work as well as magnesium does. So if you do not object, I'd like to take the extra material that we have for dust control this year and place that along that road.
Is everything else paved there, Wayne?
No, it's all gravel.
Everything on this map is gravel?
No.
Okay. Just, I understand here.
This is gravel, this is gravel, and this is gravel.
Okay.
Everything else, this pays over to somewhere right here.
Okay. All this is paved. It's been a while since it's been paved.
Yeah, that's the rest of this stuff is big.
So you just gotta have enough for that camping area?
Yes,
You think?
that seems to be the point of concern during fair time. Really what matters.
But if you do have a little extra, you will continue down around the curve. possibly.
Yes. I mean, we'll just keep working it up the road.
Keep going until we get run out.
Yes.
I don't have a problem with it.
All right.
Keep the dust down.
Well, as the product's not going on county, that's why I'm bringing it up, information for you to weigh in on. Okay, also too, I have, fortunately, we had a couple accidents. So this is as per, policy, just to give you information, a memo. These eventually go back to you, I need to make 10 copies. So these reports here are basically as they've had the accident. One was an excavator, the boom came in contact with electrical lines, hit the hot wires, and actually they fused together and then broke. And then the utility company was called. No damage to the equipment, but the operator was tested. We also had one, the other one that you'll find is basically one of our dump trucks come in contact with the ground of the electrical that was crossing an intersection. And as the truck bed was coming back down, it basically brought the ground wire down. And so the utility company was contacted, no equipment damage, but the utility company did the repairs and then the employee was tested. So as per policy, just let me pass that information on. As far as expense, it's going to be whatever the expense of the utility company come back.
As long as nobody was hurt.
Nobody did? That's absolutely right. That's the first question you asked. That was the first question we asked. So the next one is just information. And so as I pass this one around, one should be the truck, I believe, the other one's
Okay.
one would be a truck, one would be an excavator. Yes, it is kind of a template memo. So on this particular one, what we're working with Anderson County has contacted us, and on 16th Road, basically just east of the county line, they are doing a bridge deck repair. On that bridge deck repair, just similar to the one that we had done for the 6 bridges here last year. So that is going to start actually this week for them, and it should be about 30 to 45 days that the bridge will be closed. So what you're seeing on the map is with the bridge up on 16th, just east of the county line, what they're going to be utilizing is actually part of their road that goes to Westphalia, and then 12th Road and then Wayside is how they're going to come out. So just information, that road will be part of a detour by the adjoining county. The last one is just information, it's no handout, but just information. I was contacted by KDOT, and this is every 2 years and every 5 years. We participate in a statewide bridge inspection. We have one fracture critical bridge, and that's the one in Leroy. And then we have basically a requirement for an underwater inspection, and that is the bridge to the Plant Road, the one that goes by the bike. So both of those bridges, basically working through KDOT and agreement with KDOT, is they schedule the inspection, they do the work, and then they charge us a shared fee. So just information. At this point, the bridge inspection for the city of Leroy is going to be $8,400 to do that inspection.
Total cost or shared?
Yes. And then the underwater inspection, they did not have a cost. It said to be basically announced at a later date. And so the previous one that we had done was just under $2,000. So you're going to see a bill somewhere around $10,000 to $12,000 probably at this point for later.
What's that bridge? Where's that bridge at Leroy you're talking about?
It's the one you go over. It's on the south side of town. Yeah. That's a fracture critical bridge. It only has 2 stringers.
That's the one we spent $1 million on last year.
Yes.
And we got to turn around and spend $8,000 more on.
Well, it's a requirement for the state inspection. It's nothing we can pass on.
The bridge on 58 Highway, what's the time frame on tearing it out and putting it back? You see anything on that yet?
I have not.
What's the routing gonna do for that?
Well, at this point, they announced an inspection on that one. They were only doing, I think, basically the survey portion of it. They were getting the plans ready, so I don't believe you're gonna see that bridge closed for at least a couple of years.
I was thinking it's quicker than that, but I could be wrong.
You may be, but I know
That's gonna be a
that
major issue.
the surveyors, the state surveyors, the ones that come down from Topeka, were in the office a couple weeks ago. And so they were doing the investigation there. So you're gonna have at least a year or 2 of design before that bridge is, unless they have something they're gonna fast track an identical bridge.
Yeah, 2023 by the time we get that
Yeah.
bid out.
The information I've received is gonna happen quicker, but it might not have been accurate.
That's gonna make a big traffic issue.
That is a huge traffic issue, unless they put a bypass down through the creek.
They'll take them north, up to whatever street that road that is.
Well, to talk bridges is kind of the way the state does it for detours. They'll detour on their own roads. But what you see is basically local roads get used.
The local roads
Yeah, they can't take a detour over on that county road that runs up north, east of the plant.
So that's what they'll do on as far as the 58 highway bridge, they'll detour on the state roads, but then they'll basically local traffic and detour on the local roads.
54 and K31 probably, there's 2 detour routes.
And you go back.
It'd be good if they could reroute right around it like they did the Ocean River Bridge, but it won't be a big enough project to do that.
A lot of times what they're doing is if they detour on a local road, then they have to pay actually the detour cost associated with it.
And any damages done.
Yes. And so they try to stay away from that, just stay on the state routes.
But everybody figures the local route out here.
I think Humboldt had that, when they closed 169 Humboldt, that one, the old 169 road that went back through there, is actually, you found a lot of traffic, truck traffic included, that basically utilized that road. And so they came back on the state and they could prove it, that they came back on the state, and I think the state
Yeah,
repaired
that
it.
old 169 wasn't good, and it darn sure wasn't good after that was done.
Right.
Neither is 69 as far as I'm concerned. So, new road.
That's all my talking points. I'm done, Chairman.
Any questions for Wayne?
No?
Did I make it?
You did good.
I wasn't keeping track, Wayne. Some more way to give you some static.
Okay.
Thank you.
Thank you.
Take it away.
All right, thank you.
Tom, we have to make a decision on the hospital, so we might as well discuss it.
Okay.
Because we're in our we're at what, 6th day or 7th day from when they proposed it. We only have 10 days.
Six, but they came on Tuesday.
I thought maybe once they came back in to reevaluate, to give us a lot more information, it may jump or restart the 10 days, but probably not.
You know, the way that works is if we don't approve it, we can send it back to them, then they have so many days to redo it and bring it back to us.
Does anybody need further thinking on this? I mean, because if they do, we can disapprove it and approve it again in 10 days, I'm assuming.
I just
For lack
like
of
to
better
look at that
terminology.
material just for my own benefit, you know,
Okay.
is it gonna sway my vote either way? Probably not. You know, I mean, the hospital is important for the county, you know, I mean, I don't like having to, they need to manage the money that they got, you know, and they've been with the disaster of 2020 and so on and so forth. You know, I kind of go towards Bob's, you know, maybe we need to get the mill up there for them before they don't have to come in. And they can save the money and maybe get our 1.5 million back on the loan.
Well, if they're within legal status of, you know, being able to increase the mill levy, then
See, they didn't,
so be it. I guess.
they didn't ask for an increase on the ambulance.
No, it's the same.
Yeah,
Ambulance is the same.
They, when they were here talking, they actually did, because he mentioned the fact that it would still be under the 6 for the ambulance and them, but they did not ask for
The ambulance is still
an increase on the ambulance. But I was under the assumption, which you don't want to assume, that they were also wanting a meal levy, a 1 meal increase on the ambulance.
No, when they were here last week, the ambulance was.
I know, and that's what I do from last year. But but today Jeremy made the comment that, with the, 1 meal increase on the ambulance and the hospital, it would still be under the 6. Because that would be 2.83 for the hospital, 2.83 for the ambulance.
Go ahead, Angie, yes.
I got an email from Jeremy regarding that last Friday,
Mhm.
and he had said that, they wouldn't be asking anything on the ambulance, it would only be on the hospital. But he thought that the ambulance and the hospital maybe were on the same taxing line, they're
Correct.
not, they're broken out. So, and I responded to him today on that, so.
Okay.
Which he thought would be, he could go a total of 6 between the two. Correct. That's the way I took it.
Yeah, we have to keep it 6 or below for the 2.
Between the two, yes. And he was at, what?
So in a
What did he say,
sense,
5.4?
so in a sense, that would mean,
Yeah.
no, it wouldn't be. Because it's only 1.83 for,
1.08. See, you put the three of them together, 3.24. 3.24, because the mill levies at $1 million and something, and that's 1.08, isn't it? Is that right, Angie?
Yeah,
Yeah, 1.08.
1.8.
There's no in there, so like going 2 and 1, it'll be 3.24.
And they can go to 6.
That first I'd heard that, or maybe I've heard and forgotten.
no, they can only go 6.
Seemed like I may have heard from Jessica, I don't recall.
So, okay, my notes, so that makes it, 4.66 mil, is that what makes that? If you put 2 together, if we give them an extra meal, another meal, and then add them together, that's 4.66 mil total.
No. 1 mil for the hospital, or ambulance, and 2 for the hospital, isn't that 3.24
But it's 1.83.
each mil? I mean, each million, 1.83?
What they had before was 1.83, and they're asking for the same thing again.
Okay, you're probably right on that. That'd be a,
It'd be 183, 183, and then the 183. So know, 'cause they're only
I'm
at-
thinking just $1 million, that'd be 5.4 mil.
5.49.
Yeah, 5.49.
Yeah.
Well, again, as long as, it's what I come up with, maybe I'm wrong.
No, you're right.
I mean, again, if they're within guidelines, that's, for lack of better terminology, I don't have an issue with it, and the hospital isn't. We do gotta,
I don't remember when was the last time that the mill levy for the hospital was raised. It's been,
I know it hasn't been in 20 years.
it was before me, so.
really,
Wow.
20 years.
I'm sure.
So in a sense, it's
Well,
never.
then there we go.
But there's no way
Unless-
no way we can afford to lose the hospital, you know?
Well, hang on a
Just
minute.
like Iowa and Garnett, they got theirs, but
I gotta think back now. They did raise it a little bit. It used to be like 949,000. So it did get bumped up just a smidge, but in the past 20. I have to go back and pull.
I don't think it's been moved since I've been here.
No. And I think
14
when-
years.
Yeah,
Quite a
for
while.
sure it hasn't been moved in that time. So, and prior to that, it had been bumped a little bit at one time.
I definitely don't have an issue with it.
It's hard to run, it's hard to run that. I mean, it is.
And I'm assuming every county puts forth toward their hospital in a form or another. This I'm unaware of. I mean,
Well, the ones who didn't don't have the hospitals
Yeah.
anymore.
yeah.
That seems to be.
that seems to be a trend
Yep.
that we don't want to follow.
And those two that are currently with St. Luke's out of Garnett and Iowa, we don't know how well that's going. You know, those services shouldn't be discontinued pretty quick out of the home office in Kansas City, so.
I hear where I grew up, Bourbon County and Lynn. That's not a good situation.
So we need to put that in a motion.
Probably so.
What would be the best terminology for that?
If we're not gonna turn them down, do we need to even put it in a motion? I'm not sure what the procedures are.
Well, yeah, we do because we're the ones that have to raise their mill levy, right?
Right.
So, I mean, they're requesting it, but what they're requesting is that amount of money. They're not requesting an extra meal. They're not requesting it in a form of a meal. So we got to verify that it's actually in the form of a meal, and it's not that much request. If that's what we're doing.
If you don't raise the mills, then they'll be back next year actually do
Exactly.
it again,
Exactly.
instead of just be automatic.
I thought they wanted the levy increased to make that,
To make up that.
that's the way I took it last Tuesday.
I don't ever remember them saying anything about mill last Tuesday.
You know, I don't either. I didn't
Today I remember, today they said something.
I didn't hear him say a word about
I
meal
don't
last
remember
week.
it. Last
I think last week it was just $1 million and 1 and 2 on the other.
Well, that's the way I remember it.
Yeah.
I could be wrong.
Mhm.
And we haven't set the new mill levy yet.
I mean,
It appears that the mill, our valuation's gonna be at 50,000.
they were requesting what a meal this year brought,
Equal to a mill.
equal to a meal for this year,
Right.
what they were requesting. So, if we want to raise it one, if we want to raise it 1 meal, I think we need a motion to say we're going, once we raise the meal, that if we just give them the money, even though then, like Jesse said, they're going to be back next year because we haven't given them any future authority.
Just increase our mill levy.
Yeah, just increase the mill levy and roll with it.
Because our, Angie passed it around earlier, our utilities evaluation went up 55 million. So
Approximately 50,000.
that could help compensate for that fairly easily.
And this might also help them pay back that 1.5 million that they
Exactly.
said loan.
Hopefully a win-win for both.
Hopefully.
Makes sense.
We hope. Sensible spending.
Actually, they wanted to increase 1.83 to equal that mill, correct? $1 million. Is that correct? Yes.
Right, they want to, yeah, because they're at a 183 now, and they wanted to increase it 183 to get the amount of money that they wanted.
They're 183 per ambulance and per hospital.
And they didn't ask for anything on the ambulance side.
Do we want to increase it 183 or do we want to increase it 1?
In order to get $1 million, it has to be 1.83 to the zone.
That's what I'm asking, but if we go mill levy, we're not looking at it. If we increase it the amount they asked for, we have to go 183 as of right now.
That's the way I took it.
Which next year it may not be the same, but as of right now, that's what it is.
If you want some more clarification, we can ask them to come back, but that's the way I understood. And Wade's on the way.
Well, so trying to sort through, since this hasn't been done in frankly long before my time here. The statute, KSA 194606, it talks about, and I'm just gonna say, the first place you go is the law, right?
Yeah.
So the law says, and this is, the commission may levy such tax in any amount not exceeding 6 mils in any year without an election as provided in subsection C, but we're not dealing with that. And such tax shall not be subject to or within any aggregate tax levy limit prescribed by law. In the event the commission proposes to levy such tax in an amount which exceeds 2 mils but is less than 6 mils in any year, such proposition shall be published once each week for 2 consecutive weeks in the official county newspaper. If within 30 days after the last publication of the proposition, a petition signed by not less than 5% of the electors of the county who voted for the office of Secretary of State at the last preceding general election requesting an election thereon, no such levy shall be made unless the proposition is submitted to and approved by a majority of the voters of the county voting at an election held thereon. Such election shall be called and held in the manner provided under the general bond law. Any tax levied for the purpose of paying the principal and interest upon any general obligation bonds issued pursuant to this act is not subject to the 6 mil limitation imposed under the provisions of this subsection. So if I understand, presently it's under the 2, and this would take it above the 2. So
Did that above 2, not increase it to? At the very beginning
So
here, it
you
said
could increase it more than 2.
we can't. Can we increase it 2 and stay under the 6, or it cannot not exceed 2, but has to stay under the 6 without being published?
the commission proposes to levy such tax in an amount which exceeds 2 mils but is less than 6 mils in any year. Such proposition shall be published once a week for 2 consecutive weeks in the official county newspaper.
So 1.83 leaves us below the 2.
See, I'm taking this as 1.83 is below the 2 that we're proposing
this year.
It's not the total.
Okay, I misunderstood. I thought you were talking about going above.
No.
1.8.
No.
Adding 1.83 for a total of 5.49
That'd be their total mill.
between the 2 entities.
But you're only giving them a 1.8 increase, which is under the 2, which you don't fuck out of all of it.
You know, Wade, we're setting a mill levy on that, we're establishing a mill levy. Maybe I've lost something. But isn't that 1.8 inside our 51 mills that goes to the citizens? So that $1,019,000, just an arbitrary figure we give them that represents in that 1.8 inside our 51, it's not specifically designated hospital on the ballot or on.
No, it is specific.
I'm sorry?
It is specific
It is specific on
your budget.
on the budget. Okay.
So then the next statute just talks about what your options are, just so, since they're right next to each other, KSA 194607. Prior to June 1st of each year, The board shall prepare a budget showing the amount of means necessary to operate, equip, maintain, and improve the hospital for ensuring fiscal year and the amount that, of that portion thereof that is deems necessary to be raised by the tax authorized under 194606, and shall submit its proposed budget to the commission or to the county clerk. If the commission does not approve the proposed budget within 10 days after receipt thereof, it shall return the budget to the board. Upon receipt of the return budget, the board shall consider amendments or modifications and may consult with the commission concerning the budget. Within 10 days after receipt of the return budget, the board shall resubmit its proposed budget with or without amendment or modification to the commission. Within 10 days after resubmission of the proposed budget, the commission shall approve or amend or modify and approve as amended or modified such proposed budget. The commission shall adopt the proposed budget as approved and shall make the same a part of the regular county budget. So that's what your options are.
We don't approve, we send it to them for 10 days, come back and we still don't approve, then we make their budget, which I'm not in a position to make their budget.
No, I'm not either. But the question's still unanswered. Do we need to make a motion for the increase to 1.8?
We can do it because it's under the 2 for a year period, so. But again, the question is asked, do we need to put this in a motion or can we just say?
I'd always defer to a motion. You want a paper trail.
We're changing the way we do it, we probably need a motion.
So, I guess.
I don't know, I don't write motions.
Again, do we want clarification from Jeremy, make sure we're not doing something wrong, that he wants the 1.83 mill levy increase? Is that correct terminology to use? I mean, even if it's via text message, I don't really care.
I wouldn't have a
That's what I
problem,
have in email.
I wouldn't have a problem with clarifying it one more time.
1.8 million.
Just to make sure we don't gotta rescind and add a 4 to it or something like that, so. As long as we're under the 2, sounds like it can be done, so. And they're within their 6 guidelines, within their 6, so. And I haven't had an increase in a number of years, it sounds like, so it sounds like it's time to do it. With the cost of everything that's gone up in the last 10 years, let alone the last 2.
Last 6 months.
Yeah, last 6 months, gee whiz, so.
He just said we were asking for another 1 million or 1.8 mils essentially if the valuation was the same. So that would just put us over 2 million for the hospital and just over 1 million for the ambulance.
So the motion would say, make a motion to increase the mill levy for Coffee County Hospital 1.83. Is there need to be any other terminology or explanation with that?
I would put not to exceed X mill, you know.
Might be to say what the 2 total would be, the mill levy, total mill levy would be, which would be 3.66, is that correct?
3.66, yes.
For the hospital.
For the hospital and 1.83 for the ambulance.
Because this wouldn't be effective until next year anyway.
Right.
I guess we want to make that the effective date because we're working with the 2022 budget, so.
Correct.
And that affect Angie, it wouldn't be effective till January, right? Because we're working with the 2022
Right,
budget.
yeah, you would just approve, and then also you'll need to make a motion to approve the budget submitted for the hospital and the ambulance for 2022. You have to do that too.
But if we're increasing the mill levy, we don't want to approve the request that they had. Because it's two different things. The mill levy sits in itself, and if we increase the,
well, true, yeah.
the other, then we're giving them double.
Yeah, we're giving $1 million, handing them $1 million plus a mill.
So,
Well, you can approve the ambulance.
you can approve the
You can
ambulance.
approve the ambulance, but not the hospital, just raise the hospital mill levy, yeah. In the motion, which would in a sense give them the money that they're asking for.
For next year.
For next year,
But again, they're like,
for 2022.
didn't digest that until Bob said that. It's like, or whoever said that, they're wanting $1 million extra in their budget.
It's,
Which, again, didn't take effect on next
before
year.
we do it, can you, I hate to bring it back, can you email Jeremy and have him come back? I would really like to talk it through with him on that.
I can actually just call and have him come over.
On the ambulance bond?
No, ambulance, I'm fine with.
Okay, so he made a comment that there's no increase there.
Yeah.
The other, I think I know what they want, we think we know what they want, but I want to make sure that they know if we increase it 1 mil, the mill, 1.83 mil, we're not going to increase it.
Not gonna approve the budget.
Not going to approve the existing budget. So if we don't improve this budget, they might bring us back another budget for us to approve.
Basically, it'd be giving them double, right? The way I'm thinking.
Right.
But the budget request is 2,039,000. So where's it gonna be doubled up at?
So we're going to give them a meal on top of that.
On top of it.
1.83 mil on
This
top of
here
that.
is, this here does have both mills in it.
It does.
But that's not, but if we make a motion to increase the mill levy, we're increasing it another 1.83 mils.
You know,
So we give them this and that, we're giving them double.
I don't see it that way, because this is what they're requesting.
I guess the way I was digesting.
Yeah, but they would like to come back based on
Just-
other things.
We were, in order for them to survive the rest of this year, they want to know.
This has nothing to do with this year.
Yeah, yeah.
This is totally for next year.
They're just asking for $2 million for next year, which is the mill levy at 3.6.
Yeah.
That's all they asked for.
Yeah.
So to me, there's no doubling up on
I don't see it that way. That's why it'd be good to talk to, because I don't see it that way.
it. So if that's the case, they'd have been asking for $3 million.
So if we don't give them the mill increase, we'd give them what they're asking for.
But what they're asking for is got the $1 million increase, got the 1.8 mill levy.
But if we hadn't increased the mill levy, the way I'm understanding it, we still went ahead and gave them that. Now that we're increasing the mill levy, to me, it'd be doubling it.
This has got the increase in it.
It is, in a sense it
This
is,
has got
but
the
it isn't, because we're doing it two different ways. If we approve this, we're not giving them we're not giving the meal increase.
Yes, that's what I was.
But if we approve this and then turn around and give them the meal increase, we have doubled up.
But that's not what they're asking. Right, and that's not their.
That's not what they're asking.
We'll make sure.
But you have to use the mills to cover the budget. You have to raise the mill levy to cover the amount of money they're requesting.
In the budget, yes.
In the budget. But
Is the tax lid still on for this, for 2022?
It's a revenue neutral rate is what's on.
So we'll learn that when the field comes in, what our mill levy can be. So the mill levy, as we've known, the tax lid has been taken off
From what I
as
understand,
such.
yeah, that they're using the revenue neutral rate, which is still like a tax lid. It's a whole new thing, so.
Would it be better if we just commit $2 million to it and not tie it to the mill levy?
Not necessarily.
No, that was
Because if the mill levy, you get the mill levy, hopefully they don't come back in 2022 asking for another $1 million in 2023.
You got a headache out there.
Right.
Yeah.
And that's basically what he said, was if we do that, then they don't have to come back every year.
But have a chance to get the $1.5 million back.
Correct.
I got the new one.
Which is basically.
It's a wash, yeah.
So I don't think that. You have the original.
Is he gonna be able to make
For last week. Do
you wanna,
Mine disappeared.
you're on the next on the list.
I think that's a great idea.
I thought
Get off dead center here.
this one has to be,
We were gonna get off that side. We're sort of,
That's what I call it, when seem to be repeating ourselves, it's dead center.
I found this in my stack.
So the.
there it is.
Thank you.
We've already done it. All right, so if you turn to the section in your book for me, you'll see two separate tables, I guess three separate tables of organization. One for the county clerk, one for the board, I guess two for the county clerk, one for the board. And what's happening today and what the request is ultimately is that janitorial and maintenance be removed from under the direction and oversight of the county clerk and placed under the board with direct reporting to the administrative assistant. So this has been something that's been discussed before. I've been working on it for some time. I've sat and talked with Andrea, I've sat and talked with Angie, and with some of the items that are going to be coming down the pipe with our HR audit, in my opinion, it makes sense to go ahead and make this transition now. And I think, and I don't want to speak for Angie or Andrea, but I think it's with the blessing and support of both. We've sat down, we've talked about the ins and outs, why it makes sense, why it doesn't make sense, and I think, in my opinion, it makes sense. So the table of organizations that you see are the current table of organization for the county clerk. What would be the revised table of organization for the county clerk, removing janitorial maintenance from under that department. And then the third one is the revised table of organization for the board, placing the, I guess, janitorial maintenance under the county commissioners. The second piece of paper that you got, and it was Angie did the work behind the scenes, what it looks like in other counties. So you'll see a number of counties, for example, the first column, so that whoever's watching on the outside can understand the documents that are being presented. It goes through at the top county, and then commission, clerk, own department, public works, under someone else. So under the county commission, there are 12 counties where the janitorial maintenance are under that particular department. Under the clerk, 10. Own department, 6. Public works, 2. Under somebody else, 3. And that's not a representation of every county in the state, but it's a large portion. Allen, Anderson, Barber, Brown, Cloud, Cowley, Decatur, Ellis, Ellswood, Ford, Franklin, Gary, Grant, Gray, Greenwood, Harper, Lincoln, Lynn, Logan, Norton, Republic, Rice, Rook, Saline, Scott, Sheridan, Stevens, Sumner, Washington, Wichita, Wilson, just so that they're all out there.
And there was no rhyme or reason, those were just the counties that actually responded back to me.
So are there any questions? Well, I guess before I get into that. So some of the issues that you may have questions about, HVAC, the discussion regarding HVAC. And HVAC, the idea would be to have Andrea trained in how to run and operate the HVAC, but Angie could still be a backup. That would be the idea. The coordination with vendors. There would be however long a transition phase there would need to be, whether it be 3, 6, 9 months, so that Angie could help Andrea sort of transition into whatever it would take to deal with, Angie's been dealing with vendors for certain things, to help that process and see how that would work. For any large projects, what that process and procedure would be. I mean, basically, the relationship between the clerk's office and the administrative assistant would have to be intertwined for a period of time to make this work. And I think these two ladies have made a commitment that they would work together to make this endeavor happen. A question may arise about what would happen with vehicles if somebody needed to check out a vehicle so they could go to a training or some either long-term or short-term event. The county fleet sign-out would still reside in the county clerk's office because there's somebody in that department at all times. However, if there's an issue regarding maintenance that needs to be done regarding a vehicle, then someone can either notify someone in the clerk's office when they turn in that vehicle or notify the administrative assistant, because routine maintenance is important to make sure that the county fleet is up and operational in a way where it meets the needs of the user. And then a request, I think, that by the clerk's office, by Angie, is that the postage machine be placed in a different location so that it can be utilized by county employees, whoever that might be, in a different place, and that mail go to that same location as well. I think that's what we do.
The outgoing mail, departments mail out.
So,
Because that's always been a maintenance function, they take the mail to the post office, so. I would just go ahead and go with that too.
Who's gonna be doing the annual reviews, the commission or the administrative assistant?
well, we need to figure that part out.
Well, I mean, in my eyes, the administrative assistant is here more than the commission. The administrative assistant is going to be over the individuals of the janitorial system, more so, the day-to-day functions of what the commission is gonna be, so it's, I don't feel that it's gonna be worthwhile for the commission to be doing an evaluation of the individuals. It needs to be the person that's day-to-day contact with the individuals.
That would not be any different than emergency management. Carl does it, we don't do his employees. All we do would be Carl.
Correct.
So,
Well, I just wanted, because he was saying it was under the commission. So I just wanted to make sure it wasn't under the commission. It is kind of under the commission, but it's through the administrative assistant. I just wanted to get that nailed down.
But the janitorial and maintenance is officially under the commission, but they would report to the administrative assistant. That would be their reporting authority. If there were an issue, they needed something, that's who they report to. And then Andrea, if there was something that needed to be brought to the board, then it could be brought to the board. And that's the idea behind that.
Yeah, it would have to be during a meeting because you can't, no
Right.
one commissioner could run.
that's right. One commissioner has any authority. Budget, would we have to change part of the budget from the, I'm not sure if your budget, your
Well, there's
clerk's office has a separate line for,
There's a department for janitors, and we don't have one for maintenance because it's under courthouse general. But I would recommend just for you guys to go ahead and move maintenance to its own department. That way you can kind of see that, see what's happening there, and then still, because I do a lot with courthouse general, aside from, what maintenance has been under it, so I would think you probably want to break that out since you're gonna do a whole different department.
those are details that you can work on.
Right. Getting this in front of you right now so you can at least digest and consider whether it's an option you want to move forward with is why we're here today. I mean, it's been something that's been in discussion for some time behind the scenes, and that if the people who are involved are not in support of it, which would be, Andrea and Angie and then the board, then I don't think that it moves forward. But I think we have buy-in. I think it's something that appears to be a viable option, in my opinion. And now, with everything sort of going on behind the scenes, it is budget time, so things can sort of be shuffled around, moved and modified, taken into consideration, and that way, this seems like the ideal time to take it into consideration, so.
With everything else coming down the pike, like you've mentioned before, so.
And, you might not only want to hear from me, but you might want to hear from Andrea, who would be someone who would be, it would add some additional oversight to her role, and from Angie, who is changing from her direction and oversight to another department, because I'm not the only one involved with, I've discussed this with both of them, and I think you need to hear from each one of them about what their thoughts are as well, and whether they're in support of it, whether they buy into it as well.
Do we want to hold that for a little bit and take care of the hospital real quick and then jump back?
Let's do it if you don't mind.
That way they can get back.
Yeah, no, that's a good idea, Jesse, thank you. Yeah, Jeremy.
Sorry, guys, I should have just stuck around.
No, you're fine. You're fine.
We're playing jackrabbit. Jumping here, jumping there.
Well, yeah, so I'll answer any questions regarding the request that you guys have.
My question is, we've thrown it out that, we would, increase the hospital 1.83 mil, because that's basically what it is right now. And it would bring you basically what you want for next year.
Correct.
But in order to do that, we're gonna give you that extra mil, but your budget that you requested,
Yes.
we would only want you to request on 1,019,747. And then the mil would be on top of it, which would give you the extra. But that's two different things. If we approve the existing budget, we would be giving you double.
Gotcha.
Is that what you understand?
So to clarify, we're not asking for both. We're only asking for the 1.83 mils increase.
Right.
And so we calculated that based off of the current value of the mill and not what we know what the mill is gonna be for next year. So we can change the budget request form as necessary to equal the value of what the mill is, according to that 1.83 increase.
Okay. That was my concern.
Yeah.
Are you willing to do that?
Yeah.
And,
That's the way you intended it.
Yes.
That's the way I'd understood it, the way you presented it.
Yeah, we only put that 1.83 in there in the budget as the current value of what we need the mill to be.
So we need to change the budget.
you need to change, take it out of the budget, and then we
What
approved the
raise
budget,
the
but
bill?
then we approved to, we agree to give them the extra meal starting next year, which makes it come out the same.
Yeah.
But since it's two different ways of doing it.
Yes. Yeah, not asking for the dollar amount, but asking for it in value. In value.
No. So we just need to vamp his budget.
Yeah. And so with the current value of the mill, would we put in what it was last year, or is there a different value?
As of right now, we don't know. That's all we have.
So we'll leave it
It
at
could
the-
go up, could go down just a little
Okay.
bit. Shouldn't change much.
So we'll put it in on the budget as 1.019,747 and resubmit that.
And then we will give you a 1.83 meal increase.
Okay.
And, when can you do that?
When can we submit it? I can email it or bring it by right after this.
Just email it, I can print it off. And
Okay.
But don't you want the budget to say the 2,039,494?
No, we don't want to say that. We want the budget to say 1,019,747 is what they're requesting on their budget, and then we're gonna give them 1.83 meal starting next year. which would be that same amount of money, basically.
But don't you want that one line item to be 2.039,000, correct?
Yeah.
Their application, the budget to me is what they're requesting. That's what you're gonna want it to show, correct?
We need that to show.
2,039,000.
And then you're gonna increase, you're gonna increase the mill,
So they can meet their budget.
but you have to, that's what's gonna generate those dollars to get you that 2 million.
To me, the budget request is
So we're not
exactly
gonna
what
give
we
them
need.
two, we're not gonna give them the 2 million. We're not.
For the hospital year. Cause it'd be, they're getting 1 million this year,
Uh-huh.
say. And then you're gonna increase the mill to get them that extra million, so the hospital would get 2 million.
We're increasing the mill, but I see the mill as, the mill is a separate deal compared to their budget request. In other words, if he's coming in and requesting 2 million, 2,039,000, and we give that to him, that's the amount of money we're gonna give him. And then we're gonna increase it 1 mil and give him another 119 on top of that then. So the budget request for me, it to work out is gonna have to be for the 119,747 for this year.
Sure, 'cause
And then we're gonna turn around, and give him the other on top of that.
Sure, that's true.
That's the way you understand it, Gary?
Yeah, but regardless of what the value of the mill is, we're just asking for additional
Right.
0.8.
Yeah, that's what
So
we're
you
gonna
pull
do.
the budget back down to where it was at, and then we'll
Yeah.
add the 1.8.
Right.
Yeah, we're gonna give you the 1.9, and then we're gonna give you the meal on top of that. And the meal will be an automatic every year then.
Right.
You won't have to come in and ask us for any more money for
Yeah, that was the
rest of your life. But for a long time, hopefully.
Yeah.
That would prevent you having to come in every year.
Right. Yep, that's it, yeah. So,
good.
yeah. So if that works for you guys, then I can re-email that to Angie then.
Okay.
That'll work.
All right. Awesome. Thank you guys. If you need me back, call me.
Sorry. Thanks for coming back. Thank you both for coming back.
Yeah.
You're welcome.
So,
Well, we're gonna, you still on the mill, or you still on?
Yeah, still on the mill.
Okay, you're still on the hospital.
Yeah. Do we need to pass?
As soon as he gets a new budget sent to
Alright,
AEG, then
so-
we'll flip
Alright.
to the, flip back to
That's
you.
all right. We're gonna jump back and forth here for a while. We could approve the ambulance one, but we might as well wait till they got the hospital one set in front of us as well, so, in my opinion only. Did you have anything else you wanted to add to your previous discussion?
No, I think I turned it over to both Angie and Andrea to make comments, and I think that's where we were.
It sounds like you've done a lot of exploration on this, and it sounds like both parties are more than content, but if you have something you want to add, Angie or Angie, or?
Go ahead.
I was just gonna say that, with the HR audit and things that I'm gonna have to pick up extra there, that, it would be probably getting to be quite a bit with, checking over extra payroll things and things like that, so, I think that's kind of what your guys' interest was before, and so I think you might as well just make it happen and be done with it, so. Fine with me.
Yeah, I think we've talked about the transition and the time period between it, as far as, the learning, for me to know what's a big project, what do you authorize and what needs to go through you and what needs to wait till a meeting to be. So I think it'll be the process of that transition time. But we've already talked about, how that will work in the time period for that.
And you're okay with everything? Okay.
And if you guys are okay with me being a backup on the HVAC, if she's gone and you help with something, I'm willing, but that's up to you. It's your business, so.
Well, I always thought IT might be a good one to be involved in that HVAC part too.
And that's fine, I don't need to have.
That was just my personal opinions.
Now, has it been discussed with the janitorial people that this is, okay?
Well, I think it had been previously, but
It's been brought up before, brought up years ago.
yeah.
This is not new. But I think that since we have, the clerk's office who has been dealing with this, I think we shouldn't just throw it out. We should use them for backup. If they're, you know, I think the ladies agreed. I think they're gonna work it out real well. I think if Andrea needs to be gone, talk to Angie, and Angie can handle it, you can handle it. And truthfully, probably the less number of people you have on the HV in the back, the better off you're gonna be, because then it doesn't get changed.
Well, that's what the company had originally said, that you wanted to have a few people, but, you know, a person in the backup, because people could really mess with a lot of settings, so.
It sounds like.
Yeah, it don't need to be changed without somebody's knowledge, you know, where that starts, and where that stops.
It sounds like the communication link between Angie and Andrea, they've been working great here for the first 6 weeks or whatever it's been, so, and that's great to hear. So, it sounds like it's been well discovered, well explored, like Tom said, that sounds like probably a good plan to put in place.
Sounds like a good plan. We've been working on this behind the scenes for quite some time, and without having the internal discussion and buy-in, it's not gonna happen. And bringing people together and figuring out a way to deal with these types of situations is really what it's all about. And I think that's happened here, and I think that's why these recommendations are before the board right now. Now, ultimately, you get to make that decision, not me, not anybody. It's not, you know, Friday, someone came in and said, let's do this, and then bring it for you. There's been the time and dedication into why it would work, why it wouldn't work, and how it would work. And, you know, even behind the scenes, there was a discussion about it, the direction and oversight potentially being under other departments. And after discussion and exploration of how it would work with those other departments, it just didn't seem like it made as much sense as what's recommended today. So it's been months and months and months in the works, just so you know.
So these two motions originally in our book are irrelevant. It's more about these last three we've been handling, correct?
I think these new motions, or the motions that you have, there's three of them.
Correct.
One deals with the transfer of the direction and oversight of janitorial maintenance from the county clerk to the board, and then to revise each one of the table of organizations for.
I think the first motion is worded correctly. Motion for the chairman to approve the request. I don't think that's true. It should be motion for the board to approve the request. Recommendation of the chairman to sign it or whatever.
Yep, I'm fine with that.
And same way as the other one, motion for the chairman to approve. The chairman doesn't have that authority, so it has to be the board that approves.
Or you could just leave that off and just say move to approve,
Yes.
but then you will need to authorize the chairman to sign.
Right, and authorize the chairman to sign it, yes.
However you want to word it, you have a sample language, and it sounds like it just needs some different word placement for each one of those motions.
So the first one would be motion to approve the request to transfer the oversight of janitorial maintenance from Coffee County Clerk to the direction and supervision of the board, with direct reporting to the administrative assistant. The transfer is being made in anticipation of shifting of additional duties and responsibilities internally due to HR audit recommendations, and authorize the chairman to sign.
Oh, not yet.
No. Take that, strike that. So that would be how that would read, correct? Chairman, I move. Jesse's moved.
All second.
Tim seconded. Any discussion? All in favor, say aye.
Aye.
Motion passes 5-0. Next one would be motion to approve the revised table of organization for the for the county clerk, removing janitorial maintenance employees from the oversight and direction of the county clerk, and approve the chairman to sign,
And authorize and direct the chairman
to
to
sign,
sign the revised, or, let's see, hold on.
to sign revised table of organization.
Yeah.
Yes.
I'll make that motion.
Tim moved,
I'll second.
Don seconded. All in favor?
Aye.
Motion passed 5-0. Motion to approve the revised table of organization for the board, adding janitorial maintenance to the oversight and direction of the board, with direct reporting to the administrative assistant. Direct the chairman to sign. Oh,
And to authorize and direct the chairman to sign the revised table of organization.
that one.
I'll make the motion.
Tim moved,
Second.
Jesse seconded. All in favor, say aye.
Aye.
Aye. Motion passes 5-0.
That is effective
Today.
today. Well, yeah, we made a motion, so I guess it is effective. From here on.
Do you have a different one to sign, or I just sign the one?
I have a whole stack of stuff for you to sign.
Okay.
Let me just- That's the new-
So that'll take us to roundtable.
Somebody back behind me, I don't know what that is.
No, I'm sorry, I didn't see you, Raymond. You have something?
The wall is getting, sorry. I didn't even know I was gonna end up in here, so sorry for my appearance and not being on any agenda, but, are you all familiar with that Bowman Bridge out on Kennebec?
Yeah.
And then the house where Jimmy used to live?
Yeah.
He passed away. We've been trying to get that cleaned up for a number of years, and we've always been told that, well, it would eventually go to a sheriff's auction if the taxes weren't paid. And I've been talking to people for the last few years, and they said it's gotta be 3 years in a row. So a month ago, up there, they said they hadn't been paid for 18, 19, or 20. And, the thing came out last week in the paper of all those delinquent tax properties, and it wasn't in there. So I went up and talked to Brad, he said, no, because those all go to 19 and that one's a 20. And it's kind of turning into a health hazard or a nuisance or whatever, but, stumps and armadillos are coming. I live next door to that, and then Mike Dolby lives next to that. And we're having a heck of a time with all those varmints or whatever, snakes, rat, everything. It just, we would like to buy it. No one can tell us who owns it. A map I had from about 3 years ago showed Edith Shepherd and Edna Bowman, and they're both deceased. And then Brad said they set it up in a trust at one time where Jimmy was the trustee, and he's now deceased. And he said, now there is no trustee. So nothing gets done. And I said, he said, you're just a year late because these were up through 19, all of these. And that hadn't been paid in 18, 19, or 20. So I said, well, so will it be on next year? He says, well, not unless there are enough properties to hire attorneys and pay for the ads and do all that. We're just trying to get something done. Whether we need to buy it from someone or it goes to a sheriff's auction, we want to just clean it all up, get rid of the house. I've even gone to like the fire department that can do a controlled burn. They go, no, not with asphalt shingle. We don't want any money to clean it up or anything. We'll do it. It needs cleaned up because it is creating a hazard. And I don't know what to do next. And they said, well, contact the county attorney, see if there's anything to do. But I mean, there's a big hole in the roof of the house. The windows are all busted. There's an RV out there. There's a trailer out there. There used to be a few cars and some boats, and some of that's been hauled off. And we just want to clean it up. Is there anything the county can do to force an issue?
Can I see what you have?
Well, this is when I went to the health nurse a year ago. That's just a complaint form. That's a picture of it. And it looks a lot worse than that now.
Have you spoken to Harold lately?
Yeah, we even all told Harold, we'll buy it from you, but they said Harold doesn't own it.
To my knowledge, he's in the process of acquiring it. And he's gonna list it for sale. It's what the conversation I had with him a month ago.
Yeah. I mean, like I say, I don't wanna make anybody mad, we just wanna get it cleaned up, it is an eyesore, but it is becoming a health hazard, and
I agree.
And we'll just we'll mow it and we'll clean it up and get rid of all the junk. It seems like for 4 years we've been pushing this issue. I didn't realize that Jimmy died in October of 16. I thought about 3 years ago, but Brad said no, it's October of 16.
But no, I heard that Harold was going to be acquiring it. I guess that's okay to.
There's some complications, there's another person involved in it.
Yeah.
It's not going away.
Evidently Jimmy had a
Harold
half sister or something in
Yep.
Kansas City that
Yeah.
it's turning into a roadblock with her is what I've heard
That's it.
between her and Harold. So, but is there any way we can force somebody to do something?
But I'm gonna jump in. So this form, have you filled out this?
No, I haven't, because I didn't want to file a complaint against somebody. I wanted to talk to people and say, hey, you want to sell it? Can we clean it up? I don't want to make anybody mad.
So let me maybe explain it to you this way. When you fill out a complaint, that is just a formal request that action needs to be taken. And that doesn't mean enforcement action is taken upfront. And this is a good lesson so that if somebody wants to go through this process. And I've been working with Marilyn and the health department on how do we streamline the process for this exact situation. So there are several properties that seem to fit the same criteria where someone has come in, filed a complaint, and Marilyn, through her duties and responsibilities through the health department for nuisance property, sends out a letter saying, we've received a formal complaint and we ask that remedial action be taken. If it's not taken within a specified time period, then it'll be turned over to the county attorney.
Yeah, so like I say, I didn't want to make Harold mad.
Sure.
But if he's hit a roadblock, there's nothing he can do. So this might force her or somebody to take action.
So the key part.
And we better go ahead and fill this out.
If you feel like that it needs to be done, and then a letter will go out saying that a complaint's been received and please do what you can to correct the issue. We've received some responses back where there's a plan being put in place to take care of it without enforcement action, which is what could happen in a situation like this. The key for me is that somebody outside of the county fill out the complaint so that if there is action that needs to be taken later, it's not somebody, there's not some vendetta internally.
So what, you just gotta get somebody from outside the county, is that what you're saying?
No, you're a resident and a citizen who has an issue with the property, right? You're the one who would sign.
He's a neighbor.
Okay. Right, and that's what's needed, so we're not just out, we don't have county employees going out. just
You've been outside the county, not a county person.
Oh,
Yeah, a county employee just going out.
Okay, that clarifies it. That doesn't make much sense. Go to the Egg Center and get one of my buddies?
No.
You're a citizen.
We have a citizen who has a genuine concern, and then it gets looked into, and.
I will tell Harold that though, because I don't want him to think I'm sliding behind him or something, so I'll get over to Harold.
You have a problem with it.
Okay, well, like I say, we
Talk
just,
to him, I don't think Harold will have a problem.
No, he won't.
all right,
It's a process, and that process, that gives people notice that somebody has an issue with the property, which they should get notice, and then from there, they can correct it and remedy it, or the county can get involved through an enforcement action.
All right.
But that's not occurred to
but
this point.
this is, I thought, the next step I needed to take, and I didn't know that coming into the courthouse, I would have dressed better, but, yeah, sorry to interrupt your meeting, and thank you.
No, you're fine.
Thank you.
You're fine.
Yeah.
Round table.
I will need a request for 10-minute executive session.
Okay.
So request motion for commission to recess into executive session for consultation with the county counselor to discuss county policy and potential exposure related to the HR audit that was recently brought before the board. And that discussion includes matters deemed privileged under the attorney-client relationship exception to the Kansas Open Meetings Act, KSA 7543-19B2, myself and the board.
10 minutes?
10 minutes should be more than sufficient.
Give us time to stop on the way.
You got walking room?
So I need a motion.
I'll make the motion.
Tim's moved,
Second.
Jesse second. All in favor, say aye.
Aye.
We're going at 12:27.
Put down your gun, stand one minute.
Yep. Just. And then do you want, how do you want these to be?
Oh, I'm sorry, this one. You'll need a second.
Oh, he didn't date it.
Yeah, I'll make copies of these too.
Copies of that, so yeah, I'll give you that. I'll make copies of that and give you those, or do you?
Yeah, I'll, are you okay if I put those to, just get on the check? Because that's been times we've forgotten.
Yes, I do. Yeah, that's because I've already scanned them in without the signature. So do you want, you just want?
Yeah, I'll just get them. I'm not staff. Okay. I'll go up and get copies of
Okay, thank you. 11:27. Or 12:27.
Yeah.
And her she is gone this week, I didn't know. So, the mail's in our office, so we're gonna take it down there at like 1:45.
Oh, okay.
In the post
Take it.
office.
Okay.
There's your office there.
Oh, thank you.
And, probably the yard will be okay till next week, I mean.
So there's not another person?
I think she was Friday.
Okay.
She must have, I know she was saying.
What a day.
Yeah.
Oh, yeah, I'm sure.
Henry, did you get the floor swept underneath?
Oh, is there my apologies?
No. Just checking you out.
Uh,
You're supposed to say hi. Well, we are in the meeting, I guess.
We are back. Anything else for roundtable, Lee?
2 different quotes, and I'll be done. First one seems pretty fitting, just in the day and time that we're in. Great minds discuss ideas, average minds discuss events, small minds discuss people. Eleanor Roosevelt. And I think each and every one of us need to figure out which one we are. I like to discuss ideas. I don't discuss people. I don't think there's a time or a place to discuss people because I got better things to do. So I encourage each and every one of us to discuss ideas. Second part of that, integrity. And I've said this before. This is in my office. It was my dad's. He had it in his office. And it's probably one of my prized possessions of what he left to me, or left behind. The light of integrity. The soul is dyed the color of its thoughts. Think only on those things that are in line with your principles and can bear the full light of day. The content of your character is your choice. Day by day, what you choose, what you think, and what you do is who you become. Your integrity is your destiny. It is the light that guides your way. Heraclitus, Greek poet, philosopher. Each and every one of you, I do this with myself. There is no one out there who is more of a critic of me and who will challenge myself regarding my integrity more than myself. I hold myself to a higher standard than anybody ever will, and I will do that until the day I die. So I encourage each and every one of you, whether you're in this building, in this room, outside in the county, your integrity is something that only you can destroy and only something that you can follow through with. Everybody has this thing called free will, free choice. They can make decisions on their own. I choose to do what's right, regardless of whether somebody thinks it's right or not. And that's hopefully what people see and feel. I want this county to continue to be great, and I'm going to continue to do everything I can to help unify and move this county forward in a positive direction. So,
Thank you, Lee. Andy?
I don't have anything.
I do not.
Going around pretty quick. Don.
I don't have anything other than wrapping up these.
Yeah, we got some vouchers.
We got some vouchers.
We're waiting on the hospital too.
Yeah.
Yeah, we gotta wait
Waiting on the hospital.
Yeah, let's say.
Oh, yeah.
The new budget.
Well, we got the vouchers to sign, so.
But I don't have anything for roundtable either. Do you, Andrea?
No, that was just gonna be, my question was about the hospital. That was.
Well, I had a question. What are they using as a classification?
Yeah.
Because of her experience. But that doesn't have anything to do with it. Do you know what that might be? 25.
Probably wouldn't question it, wasn't even 500.
It's neat. See, there's an 18 right there.
Sheriff?
Yeah, there's 12.
All these are
It's
sheriff.
it's usually a, NEPA 500 is usually a contribution.
Let it be chefs and lemon.
Yeah, well, I just don't know why they don't say. Can't say nothing like it.
Identify. Why would they just say like step L?
Yeah.
And then it's 12 now.
Categories.
Surprising.
So it's 25. Right, well, that's what I was trying to, okay, so I see the categories here. Okay.
Yeah, it should really be step L, it should be, instead of 12.
Step 12. Well, that was my, because
Yeah.
that wasn't making any sense to me. The wage was making sense to me. But
I don't
you had
think
to
he
go
already
through
submitted
the
the check, and we probably asked her when she gets back, if she still got the check in front of her.
And I do have something to talk, Jesse brought it up. In this deal we did with the sheriff officer, their classification was 2512. Our classifications are actually ABC steps. So we need to encourage people to use it like classification 25, step L instead of step 12, instead of 12. I guess Jesse had a question with it.
Yeah, it just didn't make any sense to me. I knew where he was getting the 25, but I didn't know where he was getting the 12. And it should be step.
Since we're using it, people need to use it.
Right. I mean, that's.
Yeah.
When she did this, she had to put numbers on it, so everybody should.
I need all the help I
be
can
happy
get.
to have numbers.
Well, it's just, if we're using this,
Those are the ones, and that might be over there, that you guys said pass those out, like anything else we put on.
It does.
Because that's the way that I do it, it's either.
It's just,
We all know what we're at.
I wanted to ask you.
I have an answer for that.
You have an answer?
We have an answer for that. The answer is that the updated scale, if you will, does have numbers on it. So step L is 12.
Oh, okay. That's what it's identified. It's 2512. Is the way I take it.
In the new,
Why don't, in the
Yes,
new
because
chart,
the,
but why don't they just use the step and not worry about
What number is it?
what the number of it would be?
because in the new chart, it has a number as well as.
They're all assigned numbers, 22 numbers.
Yeah, see, mine, and
Okay, the old,
I don't think you got the new one.
In order to get.
I had Andrew sent me a new one here a week or two ago.
is there one in the book somewhere?
Well, there should have been, because that week that you asked for my pass went out to everyone, and that's when you said to keep them in your book so that they have, so everybody should have the updated.
Jesse doesn't say that, that's why he was asking.
Yeah, I can make another one, but there should,
yeah, there should be no letter because,
In order for it to work in your system
yeah,
or something like
it
that.
won't work. Letters won't work in our system.
Okay. Okay, well, that makes sense now.
I threw everything else away and folded up what I needed to keep and put it right here. And so that's what I refer to all the time.
That's not the one you need, can't have Andrew get your copy.
Yeah, the brand new sheet she printed off 2 weeks ago just says 25 step 12.
Okay. That's all I have. So,
Hey, Wade,
thank you.
do I have the wrong one?
Sir.
Yes.
You're fine.
do you need one, Tim?
Yes, I do.
Okay, I'll give
Just put it in the book.
Okay.
Thank you.
You're welcome.
What the heck is today? Jim's, I don't know.
I'm not opposed to doing more. In fact, I think we're gonna have a lot of involvement with them when we get to the new jail system.
Well, and I think Wade's gonna work behind the scenes with them too. I'm not above helping That figures up about $317 per patient. That's what you're asking for. There's 312 clients in there.
And you were given how many times they deal with that patient.
Right, they might deal with that patient 80 times. And that's $317 is that much money. To deal with, you know, to have those situations, they need to get meetings with them, like whatever.
On the state.
The sheriff's office has got over $10,000 on credit cards. I checked everything that had that 500. Tom and I couldn't identify them. I know they contribute couldn't identify exactly what was ducks unlimited or what.
We already had that ducks unlimited. We had a voucher come through. And I don't remember, I don't know if it's been, I don't either.
This is here, Tom and I couldn't identify what it was for, but I'm sure it's probably.
A credit card for 500?
Pardon?
Credit card for 500?
Yes. And most of your contributions are labeled specific.
Credit card, they wouldn't have gave credit card to Ducks Unlimited. I don't think.
No, I'm not saying it was
They
wrong,
would've-
but we couldn't identify specifically what it was for. It's 500, you already passed it. Probably on about the first sheet. So it's 500. And I got the card over there, I can't see it.
Thank you.
They should have a check on it. I forgot to check for that.
One of these days, I'm gonna do
I
that.
think
It is 500.
It'd be all right if I didn't have the speaker.
Who else gonna go? Any budget or
That's-
which one?
He says he's gonna email it to you.
Can I say something? Wade reminded me I needed to kind of give you guys a little heads up on, I'm just gonna find an email real quick here. The next round of COVID money that is due to come out. So there was an email that went out to department heads wanting to know who had applied for it. And then I got a phone call, someone asking me if I had applied for it or if I was going to. Well, I hadn't ever received a notice from the US Treasury or anything. I hadn't gotten any direction from anyone to know that maybe I could apply for it. So I said, well, I'll go ahead and see what I can do to get it applied for. And so anyway, so I got that done here, it's been a week ago, or I think a week ago, Friday. Anyway, so we should be receiving the funds pretty soon.
What was, you know how much it was for?
I do. Here.
Is that the one that's 1.6 or 7 million?
Yeah, it's,
1.6.
1617 or something. We don't have any time.
But I thought somebody had already applied for it.
Yeah, I don't know about it.
yeah, I didn't know, so I just thought I'll do what I can to get it applied for, because I didn't hated for us to lose it, so I was able to get that done. And, but it was quite interesting process.
I can only imagine.
It was, really in-depth. It took me all day to get it done, pretty much.
I'm surprised it only took a day.
Yeah.
I think we were waiting on some guidance of where we could spend it as well, but I think that actually has been published, but
I know.
they were putting a board together as far as how to disperse it. Is that correct,
I think
Andrew?
Wade's still confirming who's gonna take the lead on that. but he's
Correct.
working on
He's
it.
still waiting to hear from McNabb, is that right?
Yes.
Yes.
If a person could use part of that for mental.
First of it is, it'll probably be physically spent by a certain time frame.
Oh, I'm
Or
sure.
either donate it
I'm
to
sure.
Crosswinds or someplace else.
That's what I was wondering, if a person
But
could maybe.
they'd have to physically probably spend it by date.
Well, yeah.
Yeah.
The first person that received it would spend it by a set date, but if you gave it, if you could donate, if you could fund it like Crosswinds or something with partial, with a portion of it.
We're getting 1.588. 1.5 million.
1.5. I knew the last time we had any information on it, had no idea what it could be used for, had no idea on the time frame. It has been 3 or 4 weeks probably.
I think Uncle Joe lost my address. Trump has only got one.
He's got
another.
You get another.
I'm gonna forward the link that tells you about that.
I'm sorry?
I'll forward you guys the link that tells you about that.
What it can be spent on? Oh, okay.
You can find out everything on that.
Okay.
Just don't respond.
Yeah. Sad deal about the boating accident on, down here Saturday night, was it?
Very sad. They said they weren't even aware it was, the falls were there, they're from a different county, and you've been on that river before.
And it was in a ski boat.
Mhm.
I think it was like a ski boat.
I couldn't tell.
It wasn't a fishing boat.
Oh, I thought they were here for the cat.
No, they was not involved in the cat.
They weren't involved in
No.
that. They were from Missouri.
No, it's from
Shawnee,
Kansas City.
I heard the Shawnee area up there as well.
I don't wish that upon anybody, but. I'll shut up. Sad situation.
Very sad.
I didn't figure the Corps would shut that dam down as quick as they did.
Don't take that long to shut it down. They don't
But
take
it takes a
long.
long time to get the command to let you shut it down. That's gotta come from Tulsa, I think.
That's where their headquarters are at. Didn't take long to open it back up.
No.
Looks to me like, Don, somebody just got cash from a Visa card.
It possibly could be. It's probably something we need to ask.
Ask. We still got the deal here. Ask. That's all I can tell. Looks like,
We could have Angie come back down if Angie's available. In the sheriff's
Oh,
department.
yeah.
Sorry about that.
well, maybe.
There's Not a true identification. are
Pro Fed checkout at KSU. It might have, I don't know, it might have something to do, I don't know, some equipment. Might have something to do with some equipment, I don't know.
they? Yeah. It showed the Tom, he couldn't identify for sure.
The flat fees,
KXU, a lot of times if it's the sheriff's offices, the drone programs go through K-State Polytechnic.
Pro Fed checkout could be checking out the drone.
Well, that should, yeah, I don't know what a.
I don't know.
Eric will be down.
Thank you. Who'd you say was coming?
Eric?
Oh, Eric's coming.
I'll tell you what I'm gonna do, Jesse, I'm gonna pass it on to you, and I'm gonna put that paper clip right where it's at. So when he comes, you're the one asking the question, or let Don ask it. I'm not.
Don discovered it, Don gets that.
There's no way I could identify it.
And,
I know they're evidently doing a lot of training because there's a lot of hotels.